again, we've gone from increase to a flattening, and where we want to be is today I have better news, but I also want to say, so that people understand the truth around what's in front of us, there's no end in sight today. That's why I talk about the foreseeable future. And there will be no victory laps. What we can take from here is knowledge of what difference we can make in the COVID-19 pandemic in our state, in our country, for the foreseeable future. And to me, the takeaway is positive personal actions, responsible personal decisions, and taking personal responsibility for what happens will make a difference and better results. So we want to press on, stay the course, and do more of this. There can be no letting up. If we have any evidence from the last 2 weeks, it's what we've seen in these results. I've asked for your help. People have responded. I'm grateful. What you're doing is saving lives, protecting people, and giving lightening a load for a heavy load for our healthcare workers. So there can be no substitutes for things like masking up in Arizona. This is making a real difference, and like I said, we're seeing nearly 90% of our state that is doing this with wide compliance. The state, in addition to asking people to mask up and advocating, is funding PSAs around the reason to do it and providing and ensuring access to masks for vulnerable Arizonans. We'll have free non-medical cloth masks for Arizonans who are 65 or older or medically vulnerable starting tomorrow. So if you need a mask or want a mask, you can visit azhealth.gov/order masks to submit the order. The state's also going to work with licensed congregate care facilities to provide direct shipments to meet the needs of their residents in these categories. In addition to masks, physically distancing, keeping that distance between yourself and others, continuing to wash your hands, and remembering that you're safer at home. These are the things that today are making a difference in our state, and we want to continue doing them and doing them on a more widespread and consistent basis. Now I want to transition from this and talk a little bit about education. Arizona will be open for learning. That's what's in front of us in the coming school year. I've been visiting a lot with public K-12 education leaders, our school leaders and our superintendents, hearing from principals and others in terms of where we are, along with our fine public universities, visiting with Michael Crow, Dr. Michael Crow, Dr. Bobby Robbins, and Dr. Rita Chang to get their input on best practices and what's possible in this next school year. I want you to know that Arizona will be open for learning this school year. We've put a date out there about 5 weeks away. We've gotten the most recent input from school leaders and public school superintendents. I'm going to be sitting down and working with Superintendent of Public Instruction Kathy Hoffman, along with other constituencies, to get the best guidance on what we're going to do going forward. I know people want clarity around this, and we're going to provide clarity. I'm going to tell you, our kids are going to be learning in the fall. We're going to do our best to conduct the most positive educational year that we can, and I'll be providing the most specific guidance that I can. I'm going to be working with Superintendent Hoffman on that, and expect that next week, and that will provide additional or include additional flexibilities to our schools around the state. Now I want to touch a little bit on expanded testing in our state. We touched on Project Catapult last week. This is a project that will have us doing 35,000 tests a day by the end of July. I showed you today that currently, with all the tests we've done over this time, we're at 950,000 plus tests. When we get to the end of July, we'll be conducting or have the capacity to conduct 1 million tests a month. By the end of August, nearly 2 million tests a month. This gives us more knowledge of the virus. You can think of how helpful this will be in schools and operating businesses, and that knowledge will be power to make better decisions and to protect more people. I also want to say thank you to Dr. Michael Crow and the innovators at Arizona State University. They introduced the first of its kind COVID-19 testing. It's saliva-based, it's pain-free, and has a number of advantages. The state is going to continue to partner with the university to ramp up this kind of testing as well. And Dr. Crow, as always, has big plans on how this testing can affect life at the university level for Arizona State University and others. We've got a couple COVID-19 test strike force sites for areas that need it. This is going to begin July 17th for 12 straight days. And I want to say thank you to our federal government and the administration for their help here. It's a partnership with the Department of Health and Human Services to provide diagnostic testing in Arizona, along with cloth face coverings provided to all participants. So 2 locations, South Mountain Park, you can see the address, and Maryvale High School, beginning July 17th for 12 straight days. Please, to ensure an appointment, pre-register at azhealth.gov/surge testing. And we're going to continue to make investments in public health in the state of Arizona. I want to give you a graphic on what we've done to date on this issue. I'm not going to read through every bullet point on this slide, but it's things from unemployment benefits to things to help our schools and local municipalities, things that will help with the supply chain, personal protective equipment, contact tracing, shoring up our high schools, along with planning for a safe and healthy future in Arizona while protecting our most vulnerable, our homeless, our people that are in a position of potential eviction, along with making sure that people don't go hungry in the state of Arizona. All totaled on this one page is over $6.7 billion that has gone out to the state of Arizona. And there will be more. I'm announcing today that we're contributing and investing an additional $50 million deposit to the Public Health Fund. And with that, we'll go to Dr. Kara Christ for a public health update. Dr. Christ?
Thank you, Governor. So the first thing we want to remind everybody is know the risk of the activities that you are going to be doing if you are leaving your home. So there's several questions that you should be asking yourself as you get ready to leave. And you want to know, how many people will you interact with? Remember, the number of people that you come into contact with increases the risk, especially if they are not in your household. Will you be able to keep 6 feet of space between you and others? Will you be indoors or outdoors? So outdoors has better ventilation, more room to space out. If you are indoors and in closer proximity, that's going to put you at higher risk. And then also, how long will you be interacting with other people? The longer that you are considered a close contact of somebody, the higher your risk is for catching COVID-19. So to talk about a couple of the resources that we are providing to our hospitals, we know that our hospitals have been on the front lines of the COVID-19 response since March. So we announced last week that we were implementing a staffing initiative. As of this week, we have a contract with Vizient Incorporated to provide nursing staff to our hospitals for 6 weeks. The cost of the entire program is being assumed by ADHS. So the way that we determined which hospitals would get staffing, our first priority was to keep patients in their community. So everyone's heard of the Arizona Surge Line, where we can transfer patients to the appropriate level of care at the appropriate time so that they can get the care that they need. If hospitals in rural areas, they told us if they had more staffing, they would be able to retain more of those high acuity patients. So they were prioritized, especially those that had a high number of transfers through the surge line to other facilities. The second priority was our large metropolitan hospitals that actually accept high numbers of transfers through the Arizona surge line. So staffing, we've already made the decisions. They've been granted to each of the health systems who applied. A total of 584 nurses will be provided to aid 21 hospitals around the state. It's 250 inpatient or medical surgical nurses and 334 critical care nurses. So these are going to be your nurses. They're going to staff your ICU beds. 74% of those nurses were provided to our central and our southern regions because we know that those high acuity metropolitan hospitals are taking a significant amount of the transferred patients. The other thing that we prioritized is if that hospital was able to provide a specific capacity, such as ECMO, we wanted them to be able to have that type of staffing that could support those activities. So those will be on the ground within the next week to 10 days, and we are very excited that we were able to offer that to our hospitals. And last week, we talked about the post-acute care initiative. So we know that we have a number of patients that are in the hospital that could be discharged if they had somewhere besides home to go to. That could be a skilled nursing facility, an assisted living facility, hospice, home health. And so the executive order last week required those entities to report into our post-acute care capacity tracking dashboard, but we also know that we need additional beds. So the department has provided $10 million to expand that post-acute care capacity. We're currently in the negotiation of a contract with a skilled nursing facility system. That system actually has COVID wards and units, so we will not be introducing COVID into other skilled nursing facilities. This contract has the potential to add up to 330 additional beds statewide. And then we are engaging with other stakeholders, such as assisted living and hospice, to identify additional post-acute options. And then we are working on making sure that everyone knows how to utilize that PACT dashboard so that their discharge planners can utilize that to get patients out of the hospital and into a different environment.
Thank you very much, Doctor, and thank you for the good work your entire team is at the Department of Health Services. I know how hard they're all working, and all of Arizona is grateful. And now to Major General Mick McGuire for an update on the Guard and the Department for Emergency and Military Affairs. General McGuire.
Thanks, Governor. Since we last met, as I mentioned, our primary line of effort this week has been providing some operational capacity to the testing that's being provided by HHS and FEMA as federal partners to resource the 60,000 tests that will begin tomorrow. As the Governor mentioned, we'd asked that all my fellow citizens out there use the healthcare website, that surge testing site, to pre-register. We plan to do 2,500 tests per day at each of the two sites for a total of 5,000. When you arrive in your vehicle, you'll probably see Phoenix public safety and law enforcement folks doing traffic control along with some National Guardsmen. Some of our National Guardsmen will be assisting in registration and other logistics and wraparound services, and then our HHS contracted healthcare workers will actually do a quick test where it will be self-administered PCR testing, and then we've contract with an out-of-state lab so we don't put initial or additional pressure on our state labs, and we're looking to get those tests turned around in 48 to 72 hours. So look to get 60,000 Arizona citizens tested here in Maricopa County over the next 12 days. Additionally, on the rural testing, we just completed White Mountain Apache test blitz, Cibecue yesterday, and today the community of White River. 22 of our National Guardsmen out there assisting with our tribal partners, just as we have with Navajo Nation and last week with Tohono O'odham. And we are continuing to work to ensure the logistics and food supply, looking to extend our mission beyond the 24th of July in the food banks and food distribution missions we've been running out of state to help the increased demand.
Thank you very much, and thanks for the good work of the Guard and DEMA. And boy, you all and your team have been on every front throughout the pandemic, and very grateful to the team as well. So thank you.
Sir.
I want to give an update on not only public health, but what's happening with Arizona families in the state of Arizona, especially families that have been displaced through this. Let's start with pandemic unemployment assistance and relief. Over $6.4 billion in unemployment benefit claims have been paid to date, helping over 958,000 Arizonans. It's almost impossible to get your head around that number. Before the pandemic struck, I think we had less than 17,000 people in our state on unemployment. Today it's over 958,000. I want people to be aware that are receiving these benefits, that we are experiencing fraud attempts. They've been witnessed in other states. We've been working with the FBI and Department of Labor to continue combating this fraud and to ensure the dollars are preserved for the Arizonans that need them. And I realize it may have caused some inconvenience or slight interruption in some of your payments. We think we have our hands around that now, and there will be more to follow. I also want to talk about the housing protections for Arizonans protected by COVID-19. It's been some time since we talked about the March 24th executive order to delay evictions for those impacted by COVID-19. This established the COVID-19 Rental Assistance Program administered by the Arizona Community Action Agencies. To date, we've put $1.2 million plus provided to Arizona renters, and the order is scheduled to expire July 25th. So I've got an update on this, along with a new executive order extending the eviction moratorium on residential evictions until October 31st, along with $650,000 for community action agencies to improve staffing and administration of rental assistance programs and providing assistance to families and individuals faster. In addition, $5 million to establish the foreclosure prevention program. And this will provide targeted relief to homeowners who rely on income from tenants to help them avoid foreclosure. In total, state and local governments have directed more than $80 million on programs to assist renters and prevent homelessness. Additional actions. Earlier this week, $1.6 million from the U.S. Department of Housing and Urban Development Emergency Solutions Grant was distributed to combat homelessness. This is going to support counseling service, guidance on independent living, rental assistance, as well as homeless shelters throughout the state. In addition, we've provided $250,000 from Chicanos por la Causa, and I want to thank David Adami for the organization's statewide housing program, which finds housing for homeless individuals. And in May, $300,000 provided to St. Vincent de Paul and Open Hearts, providing Arizonans in need with rental assistance, telehealth, and transportation to health services. So moving forward, our plan of action will remain to be a responsible approach, and it's going to be guided by public health. We are going to dramatically ramp up our testing facilities to identify these infections by increasing the lab capacity, along with additional collection sites focusing on the areas in our state and the people that need it most. We'll continue relief to county health officials and contact tracing to contain the spread, and we're going to monitor the efficacy of all our mitigation strategies and make changes and adjustments as necessary. I was asked a lot this past week on with all the metrics that are out there, if people wanted to simplify the metrics that they watched or the metrics that they could find to see if Arizona was going in the right direction, which metrics would I recommend. Many of the public education leaders wanted us to find one metric, and I wish that there were one metric that could simplify decision-making. But I wanted to point out 4 different metrics that I think if you wanted to get an overview of what's happening, and the first is cases. And I want you to know that in Arizona, with the way we're going to ramp up testing of 35,000 a day at the end of July and 65,000 at the end of August, you're going to see more cases. And the way to measure your level of concern on those cases is the percent positivity rate. So we're going to increase the testing. Will give us many more points of knowledge around the state of how we're doing, and we want to see that positivity rate coming down. That's both at the state and county level. And I think you could imagine, just from logic and common sense, the 954,000 tests that we've done to date have been done on sick people and symptomatic people and people that have been exposed to COVID-19. Now, there is a great demand for many people across the state who are not sick or symptomatic who want a test. Doing this should allow us to bring the positivity rate by its very nature. The next thing is the mobility and the R-naught. Arizonans are safer at home. This metric quantifies non-essential travel. The R-naught indicates the speed of the virus. So if you'll watch the mobility and the R-naught, you can help impact what's happening in the state of Arizona. And of course, capacity. Capacity is something we think about every day of the week and every day of the month. That's both the capacity in our fine hospitals and places where we can help people, but also our capacity of boots on the ground, doctors, nurses, staff, healthcare professionals, emergency responders, and people that are coming to help us from out of state where the federal government has stepped up. So next steps, in terms of action steps, please keep doing what you're doing. Wear a mask, wash your hands, physically distance, and stay at home. If you take these on as patriotic duties, you will help us reduce the spread of this virus. You will protect people and livelihoods, and you will remove some of the burden that is on all of our state and country's health care providers. And always, remember, wear a mask, the virus is widespread, and you are safer at home. And with that, let's move to questions.
We'll start up front with Billy. Billy Hartbosch, iHeartRadio. Thank you, Governor. I don't know if you've seen this yet today, but White House Press Secretary Kayleigh McEnany, she said, science should not stand in the way of reopening schools. You're about to make a very important decision next week on schools. The president has said he expects schools to be open. He also said he's going to pressure governors into doing that. Have you felt pressure from the president yet, and how much will what the White House says influence your decision?
I'm going to let public health continue to be my guide. I haven't seen that. There's a lot of breaking news every day, and I'm going to focus on my day job. I'm going to do what's right for Arizona. And I've said this several times. I'm not going to let politics get in the way of this. I want to do what's right for our state and for our kids, and our decisions to date have been informed by public health. Thank you, Billy.
Good afternoon, Governor. Wanted to talk to you about where we are today and your response to this COVID epidemic up until now has led the state, at least the county, to the point now that they're bringing in extra coolers. Medical examiner is working under surge capacity to handle the dead bodies down there. I wanted to ask you, considering when you look back at this response, and it has not been successful up to this point, do you think you need to change up staff, bring in new perspectives, bring in new people to ensure that maybe this doesn't happen again?
So I want to say that I'm very confident that with what we know now, we can certainly avoid the type of increase in cases that we've seen. I have incredible confidence in the Department of Health Services, Dr. Kara Christ, and the people that are advising me on this. And I want, Dr. Christ, if you would talk about what's happening at the county facilities around some of the news and how that is affected by the environment of COVID.
Absolutely. Thank you, Governor. So when we look at fatalities management, there is a statewide plan. Every summer, we do see an increase in the number of deaths. When you look at what the medical examiner is looking at, the majority of those deaths are not going to be COVID related. They're going to be the unexpected or the unexplained deaths that need to be investigated. We are working with our hospitals to ensure that they have adequate morgue capacity, but one of the normal elements of the plan is to bring in refrigerated trucks.
Yeah, but 2,492 deaths, is that a successful response?
We mourn every death that we have. We don't want to have deaths, and we know that if we can reduce the spread of the virus, and for weeks and weeks, months upon months, we were very slow in terms of case count. We did have that spike in terms of June. We've made adjustments, and this is something where you want to stay vigilant, you want to have flexibility, and be humble. We know more today, and I'm confident that we'll continue to make better informed decisions going forward.
I just got one more follow-up here about the R-naught. You said that this is a metric to watch, and as an example, you used where that was at June 29th at 1.18. This is an example of, you said, where you don't want the state to be. It happens to be that the R-naught was at 1.18 on May 15th, yet you opened up the state anyway. Why did you do that, considering that this is a metric that you are now saying is something to watch?
Well, it's something that you have to watch. I mean, and the metrics move, and we did not have the spike in cases that we have today on May 15th. And in hindsight, everything is crystal clear.
We're going to go to Andrew with the Republic next.
But Andrew, before you get started, the other thing I want to say is that on May 15th, in terms of where we were in positivity, which is another metric that we look at, it had slowed to a crawl. So there's a number of metrics that you look at in terms of making these decisions. Go ahead, please, Andrew.
I want to circle back to unemployment. Unless Congress comes through with something pretty quickly, a lot of Arizonans are going to see a pretty substantial decrease in their unemployment benefits very soon. What are you looking at doing on a state level to ensure that a lot of jobless Arizonans are not getting by on $240 a week?
Thank you, Andrew. And to date, through the pandemic, since Congress has been able to act, we've been able to provide displaced Arizonans $840 a week out of the Department of Economic Services. This is something we've been talking with the delegation about, talking with the White House about as well. There is a fourth package coming. We're not sure exactly what it's going to be. We're going to advocate for what's in the best interest of Arizona and Arizonans. To date, we've been able, to the best of our ability, and you've seen that over $6.4 billion to ensure that no one falls through the cracks or falls through the social safety net. Over time, of course, we want to see Arizonans, where possible and safe, return back to work. And I don't often get the opportunity to give compliments to Congress, but I will say that they have provided the resources to our state through this pandemic. And I think everybody realizes that Congress almost always acts at the last minute. So we are exploring what our options are and what the possibilities of what they're trial ballooning and putting forward in terms of packages and amendments. Arizona's in a position where we have options, and we will want to explore those options when and if necessary. I want you to know it's something that's topical among our senior staff.
Speaking of getting back to work, though, I think it was House Majority Leader Warren Peterson previously commented that people would go back to work when unemployment insurance is cut. Do you share that outlook, and is that even really possible if we're going to be in a situation where bars, restaurants, some industries are going to be operating at limited capacity or going to be closed? Is that a reasonable expectation?
What we want to do is make sure that people don't fall through the cracks. What we don't want to do is incent someone who would otherwise go back to work to not go back to work. And even in the environment we're in right now, I mean, it's been my experience, most people want to work. Okay, they'd like to go back to their job if they are able. And in the last month, we've seen 19,700 Arizonans return to work. So we want to do the right thing, and that's what's going to guide us.
Do you think people feel it's safe to go back to work, though, at a time like this?
Well, it depends on who you are and where you're working, in your own personal situation.
Hi, everyone. Governor, you touted some positive news in today's briefing, but the reality is the state's largest county, they're bringing in 14 coolers to find a place to store the dead bodies, something that hasn't been done in 10 years. Bodies aren't able to be stored in a normal way now. The fact is bodies are adding up, space is running out. At this point, why should anyone believe what you're saying?
First, I want to say you're mischaracterizing what's happening in relation to COVID-19, and Dr. Chris can inform the rest of that and what happens in the state of Arizona, because we are headed in a better trajectory, because we went for weeks and weeks and months with a very slow increase in cases, and now we're going in the right direction again. Arizonans have been helpful, they've been partners, and they've been part of this. I'm going to ask them to continue to do that. Will you talk, hang on, please. Will you please, so people understand what's happening in the news that's being reported from the county level, again, reiterate for people that weren't listening the first time you gave the
They
answer
ordered
around.
14
Please.
coolers
Yes.
by next week to get them.
So we're working very closely with Maricopa County on developing a plan. So every summer we see increased deaths due to heat-related illness. We are also seeing increased deaths, unfortunately, due to suicide and drug overdoses. In addition, we know that we've got the COVID-related deaths. So what we are doing is we are working with Maricopa County on trying to get the decedents out of the medical examiner's office and into the funeral homes for final disposition, because they are almost at capacity. The rest of the state actually has capacity to handle any of the decedents or those that need care. But we continue to work and to identify solutions for our hospitals and the county.
Maricopa County hasn't ordered coolers in 10 years, though. And Governor, I've asked you what guides your decisions, politics, the economy, science. You say public health, but elected officials, former elected officials, citizens, and businesses say your decisions are half-measured. Are you trying to protect your image instead of making tough decisions?
There's a lot of critics out there. And if I listened to all my critics, I wouldn't have any time to focus on this pandemic. I'm going to make the best possible decisions informed by public health, do the right thing, and do my best. Now, I want you to know that there are two very loud lobbies out there. One is the lock it down lobby, and they want to see everything locked down. And they weren't even happy when we had a stay-home order and we did not have rising cases. The other very loud lobby is the government's not going to tell me what to do lobby. Very American thing to think and say, not during a pandemic. Both of these pretty loud, pretty large constituencies. Think of the decisions I've made, because I'm not following public polling. I'm following public health. So I'm not going to please the lock it all down forever lobby, and folks that don't want us to make decisions to protect people aren't very happy either. That's why I'm going to continue to follow public health. It won't be very popular, but I know in my heart it's the right thing to do, and that's what's going to guide decision making going forward.
And just my last question, really quick. The maps that you show up there, the White House put out a report on the 14th, and it shows most of Arizona all in dark oranges for new cases. How do you pick which charts you're going to show us? Are they to fit your narrative?
You should go to the COVID Trafficking Project. I think it's done by The Atlantic. It gives Arizona an A+ for the information that comes out of the Arizona Department of Health Services. That's on the website, azhealth.gov. Every map that's been put out there is reflective, but their sources independent. I put up the New York Times and CNN that validates what our own internal information is.
Okay.
We're going to go to Zoom next. Thank you, Nicole. We're going to go to Kathy Ritchie from KJZZ. Kathy, go ahead. Kathy, you need to unmute.
Sorry about that. Can you hear me?
Yes, we can hear you. Please go ahead.
Good afternoon. My question is really about testing in long-term care facilities. HHS said that there should be weekly testing of staff. I know that there have been 2 rounds of testing completed in the skilled nursing homes. That doesn't include assisted living facilities. There are 2,500 or so assisted living facilities in Arizona. What's the status of testing? Can we expect weekly testing of staff? Because that really seems to be the step towards reopening nursing homes, and it has been 19 weeks since families have had in-person visits with their families. So where are we at with testing in these facilities? Rapid testing results, which I hear is critical to the reopening, and weekly testing of staff, or even daily if possible. What's the latest on that and the reopening?
So thank you, Kathy. That is a great question, because we definitely want anyone who's in a long-term care facility to be able to spend time with their loved ones, and we know that it's been a very long time. We are working with our federal partners. They will be distributing to our skilled nursing facilities rapid antigen tests that can be done in a very quick period of time, along with testing kits. That will allow our long-term care providers to test their staff weekly, but to also test patients and as well as visitors if that's what they wanted to implement. We're going to be working with those long-term care facilities to ensure that they have the testing kits that they need to have that ongoing. We are starting the assisted living testing so that we can move into that. Some of that will be done with grants to the actual facilities, and some of it is arranged through the Department of Health Services.
And one other, go ahead.
I'm sorry, thank you. Will that be ongoing? Because what the skilled nursing facilities are getting, they're regulated by CMS. The assisted living facilities are not, even though the population is similar. So I'm just curious, if the skilled nursing facilities are getting those rapid tests, assisted living, will that be ongoing? What's the status of that? Because so many Arizonans live in assisted living, whether it's a group home or an assisted living center.
So we are taking a look at that. Our priority would be the assisted living centers on that, but we're looking at what the capacity is to be able to offer that to our assisted living facilities.
So that's not the ongoing testing then right now is not happening. You're still sort of planning that. It's in the planning process.
Yes. So that part is still in the planning process as we're starting the testing for the assisted living staff and residents.
Okay. Thank you.
The other thing I want to say to Kathy is that we should add that to our list of incentives to remember that it's safer at home and to wear a mask and to socially distance. We do have guidance available once we get into a safer area in terms of case and spread, where people can go visit their loved ones inside a nursing home. Part of it's the guidance and the testing, and I know how much people want to do that, and we want you to be able to do it in a safe way. So we need to continue this downward trajectory.
We're going to come back to the room. Paul, can we get from NBC News, please?
Couple questions. St. Luke's, is there an update that you guys have? To my understanding, you guys have signed a contract and signed a lease with the building. And is that the same thing as the skilled nursing facility that you guys introduced to us in the earlier graph? And following up on Kathy's question, it sounds like Sonora Quest is making great strides. They're going to have their machinery in there to begin to expand testing operations here for the actual processing. At the same time, what do you guys see as the future of expanded rapid testing here in the state? And sorry, my one other piece here is more along the lines of not from the shut it down lobby, but I was just talking with an ICU nurse who spent 2 months, May and June, in New York, and he said he was disheartened. He just came back and he's now working out of a hospital here. And he said compared to what he saw in New York and essentially how those streets were shut down and folks took it seriously and were able to bring their case number down quite rapidly, he said then he came back here and he's concerned that this is just going to be prolonged. And he said he's encouraged to see those hospitalizations plateau and some of these early indicators, but we still have a percent positive number, 20%. To folks like Shannon Sims, that ICU nurse, what would you tell him in terms of why not take those additional steps of not shutting down like indoor dining at this point?
Will you touch on St. Luke's and testing, and I'll talk about the policies?
Sure, thank you. Thanks, Juan. For St. Luke's, so we do have St. Luke's ready as a warm site. We have a contractor that could come in, provide the equipment and the staffing, and run St. Luke's. That is, we've always had that as kind of a last resort option. It is ready to go. What we would like to see is Arizonans provided care in licensed, regulated facilities. And so working with our long-term care providers, that would be our first option. However, we do always have St. Luke's if that is needed. So that's where we're planning right now. For the testing, so yes, Sonora Quest has done a phenomenal job, and we are so excited that they have been able to add capacity. We are looking at the possibility of rapid tests. They are not as efficient, and so they really are that 1-by-1 or 1-by-2 type test, like if you had a visitor that was coming in, or if you needed to quickly assess whether a patient should be in COVID precautions or not. As they become with the rapid, the antigen test, that will be more like a strep test that you'd be able to do in a doctor's office. The sensitivity and specificity aren't really what the PCR is, but it's a really good, just quick answer. So we're looking at how we could deploy that statewide. But the other thing that we're doing is looking to enhance the access to testing. So we're working with some of our county health departments to identify areas in Pima County and Coconino so that we can expand testing throughout the state.
Is that rapid testing? Has Sonora Quest indicated that they're going to be looking to expand that as sort of their next step?
I haven't talked to Sonora Quest specifically about that. Usually those are kind of point of care in like doctor's offices, and so it may be something that they're looking at.
And Vaughn, the answer that I would give is that we want to do everything we can to break up these large gatherings. That's the evidence that we have that's guided by public health. And I know I get requests from across the board, and I know people in all of these camps. My decision is being informed and guided by public health. And I know that's not the popular decision, but I believe it's the right decision. And I know over the course of time, as we get through this, Arizonans will see that it was that discipline that will steer us through this.
When you see places like Prescott was blue on that map, and you saw the images yourself over the last 2 weeks, does that give you pause that maybe you should take that additional step of like a statewide mask ordinance?
I want to see the maximum compliance with masks. I want to see every Arizonan wear a mask, including all my friends in Prescott. And I believe the decision that we're making in allowing this final decision to be made at the local level depoliticizes an issue that should never be politicized and has wider compliance. So I'm going to leave that up to those local officials and maybe some of the evidence that they're seeing, because if you remember, it wasn't that long ago when we gave the authority to the local mayors and local county supervisors that Yavapai County was at 3%. And today, like you said, they're blue and in a position where action would be helpful.
Thank you, guys.
Go to Michael from 12, and then Holly from Cap Media Services.
Thank you, Governor. With the county officials ordering those 14 coolers, they're saying they're worried about a clog, potentially, when it comes to the number of deaths and not having space for those bodies. And like you said, the one trend that you said that is going up is the number of ICU beds and hospital beds taken up. What should people be expecting when it comes to potential deaths moving forward over the next couple of weeks?
Well, I can't predict the future. I know that if we reduce cases, we'll reduce illnesses and we reduce hospitalizations. And I just want to reemphasize what Dr. Chris said about what happens in the summer and what happens during flu season. And she also mentioned something that I think is lost from much of this discussion because our focus is and should be laser focused on COVID-19. But she talked about the suicides and the drug overdoses that are happening. So public health includes many things, and that's what we're addressing.
But the concern is more than just, 14 coolers is a lot. I know they may be trying to go above and beyond, but...
I think Dr. Christ answered this question twice.
Well, I got a couple more quick questions for you. You talked about education making a decision next week. Superintendent Hoffman said you've called the date August 17th aspirational before. How optimistic are you that August 17th is really going to be a date that we can see something real?
I'm going to visit with Superintendent Hoffman, and we'll have details next week.
Okay.
We want to make sure we get through as many ballots as possible. We have a lot of people on Zoom, so if we could, we're going to Howie and we'll try and get through as much as we can.
Just one quick last question for you. Yeah, last one. Yeah, on the Wall Street Journal, we saw from SonoraQuest, their leader, they said that they thought that this virus may go away during the summer, or at least reduce during the summer. That didn't really seem to follow the facts. Did you actually believe that this would go down during the summer?
You have a question for SonoraQuest. We've been preparing since really sometime in March for a worst case scenario. That's why we talk about 600 plus ICU beds that we haven't had to use, 2,600 hospital beds that we haven't yet have to use, the amount of investment that we've put into testing. So we've always been planning ahead. If you've got a question for leaders of other organizations or businesses, I ask you to ask them.
Well, we rely a lot of them on testing, and they said they were behind on testing because of that.
Yeah, and that sounds like a question for them because we want testing ramped up, and we're sharing with people that we're going to have 35,000 tests a day by the end of this month, 65,000 tests a day by the end of August, and to date we've conducted 954,000 tests. We need more, and we need more rapid results, and that's what's on the way.
Let me start with you, Dr. Chris, because you mentioned something about a rise in suicides and drug use, and also affecting the fact that we've got a lot more bodies in the morgue. Are you somehow linking COVID and the virus and any of the orders to the rise in suicides and drug use, or is that just seasonal?
So the heat-related illnesses, Howie, would be seasonal.
Understood.
We are seeing an increase in drug overdose and in suicides, not just here in Arizona, but nationally. And so could some of that be associated to the isolation and loneliness? That was one of the things that we were worried about. We wanted to make sure that Arizonans, when we had the stay-at-home order, also had this stay connected. And we do know that this has been hard, particularly on our students. And so that's just one of many things that's playing a role, unfortunately, in what's going on at the medical examiners and at our hospitals.
Okay. Other question for you, Governor. As you know, CDC issues state-specific recommendations every week. And the latest recommendations from the CDC say to limit indoor dining to less than 25% and decrease gathering limits to 10. We're at 50% and 50. You keep telling us you're following CDC guidelines. Why aren't you doing that?
I'm informed by the guidelines of CDC. Those are our recommendations. We've restricted in-store dining or in-restaurant dining to 50%. We're 5 days into this. We're seeing the results that we've seen over the last 2 weeks, so we're going to continually monitor it.
So at this point, you're not interested?
We're going to continually monitor it. We've also put additional guidance that limits the amount of people that are in there. The key is to socially distance and make those responsible decisions. But listen, we'll make adjustments, and like I said, they'll be incremental, and they're targeted and focused on better results for our state, and we'll continue to do it, and they are guided by public health.
Great, thank you.
Hello, Governor. Good to see everybody. I'm sure a lot of Arizonans are very happy you extended the eviction moratorium today. Maybe not so much landlords, but I want to ask about the Renters Assistance Program. That money is getting out at a snail's pace. We've been doing our independent, we're talking $20,000 in a week, maybe even $5,000 in a week. Is that program a failure? We've heard about backlogs in counties and whatnot. There's still a lot of money left and a lot of people who need it. Is that program?
The program is not a failure. I think you may have seen earlier in the presentation that we've had over $5.4 billion in federal funds go out. That's $840 a week to people. So if you're receiving $840 a week, which we're told for many that were displaced is actually more money than what they were receiving before, their rents are up to date.
And I want to switch gears to educate. I'll keep this.
Or they should be up to date. We also, I would ask, we don't want people to fall behind on their rents. If the conviction order is not there so that they don't pay their rent, it's so that they don't lose a place to live. It's so that homelessness is not increased. But if you're receiving those federal dollars, and there's 951,000 Arizonans that are in receipt of them, they should be up to speed on their rent and their mortgage, and most of them are.
But there's still that backlog. There's still that backlog in counties
we put additional dollars in there so that we could get additional monies to the county so they could be more responsive. That's part of the order.
So real quick, just to pivot to education real quick. I know you're going to be meeting with the superintendent. I know you guys have had a lot of conversations. But you yourself, would you feel comfortable sending your kids back to school now? You would?
Yes.
You have no qualms about it at all?
Well, I want to turn that over to a public health expert who has 3 kids that may be in school. Will you just answer from a public health perspective, please?
So thank you. Yeah, that's a great question. And right now, we had to just make the decision on whether our children would be going back doing either the virtual academy or a in-person school when it resumes. My husband and I made the decision that we would like our children to be back in school. We know, based on the information we have right now, that kids are at low risk for transmission and for outcomes. I have noticed some other detrimental impacts from my kids not being in school, and I really would like them to be back in that social environment.
Thank you.
We're going to go to the Zoom board next. Hank Stevenson from the Yellow Sheet Report. Hank, go ahead.
Thank you, Governor. So you say that your decisions are guided by science and data. Are you willing to commit to opening schools based on science and data, some sort of a metric system rather than an arbitrary date?
So, Hank, I'm going to work with Superintendent Hoffman. Our decisions are going to be informed by public health and the safety of our kids, our teachers, the staff, and the people that work inside our schools. There will be more to follow on that.
That didn't answer the question, though, Governor. Right now,
I said it will be informed by public health.
Yeah, and informing it by public health, most people would agree that that means going off of data rather than a date. Are you sticking to a date, or are you going to set it based on data?
Hank, I said that the date is aspirational. We have some of our school leaders who we're listening to who have already made some decisions around their schools, but the learning is going to begin on or before that date, regardless of the decisions that are done either at the state or local level. There will be more to follow on this next week, more specifics.
We're going to come to the room. We're going to go to Courtney with ABC 15, and we'll go to Jeremy.
Hi, Governor.
Hi, Courtney.
I'm going to switch gears here a little bit. In the weeks since you met with Black pastors, Black parents, to talk about police violence, systemic racism, there have been several shootings. You've indicated a willingness to diversify AZ Post, de-escalation training, body-worn cameras. What is your timetable on getting these things done?
Thank you, Courtney. the visit and subsequent conversations that I've had with leaders in the community have allowed us to focus on a number of things. One, it was this to-do list of actionable or deliverable items. One was the idea that in these areas they have health issues around COVID-19, and they wanted more focused testing, and you've seen that ongoing. You've seen it in today's announcement as well. The other idea was what the governor's office can do around the diversification of AZ Post. We're working on that as we speak. And then there's additional things that we're going to do from the Department of Public Safety in terms of how we handle training inside the state, and that's being led by my Colonel of Public Instruction, Heston Silbert, and I know he's working with Jerry Williams and Paul Penzone and I believe Chris Magnus and others.
Are there other things that you are looking at doing yourself without legislative help?
Well, first I want to say I want legislative help on this. The legislature was on board for body cameras, and body cameras was another request, and that would have happened in this legislative session, except we closed up rather quickly because of what happened with COVID-19. So to me, I think the best policy is done when you've got the branches of government working together. So we want to be working with the community and be doing the right things that are measurable and that will make a difference. 3 of them we can do by and large through the governor's office. The other, we're going to need the legislature's help, and I think there's more beyond that.
And this is my final question. Legislatively, are you looking to have a special session of any sort about COVID, about police reform, about anything?
So I continue to talk with legislative leaders. I had a visit with Rusty Bowers, the Speaker of the House, and Senator Karen Fann, President of the Senate. I know that we're also engaging the delegation, and as necessary and if necessary, we will do that.
Thank you.
Hi, Jeremy.
2 questions. First, a few weeks ago, you ordered the Department of Liquor to stop issuing licenses for large gatherings, limited or restricted gatherings of more than 50 across the state. There are still a lot of events on the calendar for the remainder of the year that the Liquor Department had already approved that will have, God knows how many people, a lot of them sometimes in places that don't require masks. Have you given any thought to canceling those events to prevent these large gatherings that could potentially spread COVID?
We're going to review things that are on the calendar or things that are going to happen in the future that have been planned and where government has a role in that decision making or local government has a role. We're going to be advocating or making the necessary decisions from our office.
Okay. Second question, the Commission on Appellate Court Appointments this week announced that it was starting to take applications for the Redistricting Commission. Now that commission, according to the Arizona Constitution, is supposed to pretty closely reflect the population of Arizona. Currently it has, I think, only 1 non-white member and 0 Democrats. Do you plan to fill, I think there's 4 vacant seats, do you plan to fill those seats to make it more reflective of Arizona's population before they select these redistricting applicants?
I think you'll see the applicants and the decisions be more reflective.
Before the redistricting candidates are selected?
Yes.
Let me start to wrap it up here. We're going to go to Zoom next for one more question. This will be from Brenna Goff from Bloomberg News. Brenna, go ahead.
Thank you, and hello, Governor. You are one of 5 governors around the country that are facing recall efforts based on some of the executive actions taken during the course of the pandemic, mostly aimed at slowing the spread of the virus, such as shutting down businesses. And I'm wondering what your response is to the citizen groups around the country that are organizing these efforts and saying that the actions go beyond a governor's power, that they are unconstitutional, and that they infringe on people's rights.
I would say to them that I'm 100% focused on the pandemic and making the right decisions from the governor's office to protect people and doing the right thing. I'm not paying attention at all to politics or these groups that want to say that a governor doesn't have the legal rights that I have been granted in a public health emergency. I can't wait to have government restored to how it was before the pandemic, but that's not where we are today. So with that, I want to just say thank you. We've seen some encouraging news today. I want to reiterate that it's not a victory lap. It should be a validation of the decisions that we make as citizens in terms of personal actions and personal responsibility that we take can make a difference in our state. I want to thank Arizonans from across the board for staying focused on the task at hand and what's in front of us. Let's keep pressing in this direction. And if you will, the message is you are safer at home. But if you need to go out, what I'm asking you to do is just to limit that mobility. If you need to go out to eat, to limit that mobility and head home. And make sure you're wearing a mask, that you're helping other people understand the gravity of the situation. There's strength in numbers here, and the more numbers that are making the better decisions, the better off we will all be. Again, thank you to everyone, especially our healthcare workers.
All right, everybody, again, that was Arizona Governor Doug Ducey and Dr. Kara Kriss talking about the latest coronavirus update here in Arizona. And they said they will be talking about when schools can reopen for in-person instruction, and that essentially we're moving in the right direction. That's according to the governor himself. So if you happen to miss any of that, I will clip it on YouTube, and you can watch it as many times as you'd like and share it with your friends, your family, your coworkers, your neighbors, everybody you know. I'm going to take you out to the state of Washington next, where Governor Inslee just wrapped up their coronavirus update.
By the federal judge in Spokane yesterday, the court firmly dismissed a court challenge to the use of the state of Washington through the governor's emergency powers to curb the spread of 19 that was challenged. And the court, in quite strong language, dismissed that challenge. This is great news for the state of Washington because it allows the state to continue to protect that which is most precious to us, which is the health and safety and lives of Washingtonians. I should note that the state of Washington has not lost any of the challenges that have been posed to date in any of the lawsuits, and I would expect that record to continue. I've been alerted that the plaintiff in that case, Slidewater of Chelan County, has been operating in violation of that order, and we can expect that through the Department of Labor and Industries, there will be penalties associated with that noncompliance. I want to thank the Attorney General's office for working on this. This saves lives. And I want to thank our counsel, Catherine Leathers, who's been working on this day and night for several months to draft these orders with the utmost respect for the U.S. and state constitutions. As I've said, we've had enormous adherence to our orders. I want to thank Washingtonians who have stepped up to the plate. It is unfortunate that there's a few folks that have endangered other Washingtonians by their risky behavior, and we simply cannot allow that to continue. So we have some good news today in this effort against the COVID pandemic. We know we have problems in this state right now, but we know that they can be addressed by individual action and restraint. We know that we as individuals and as family members can take action to reduce the scope of this pandemic. Now, we've had some new challenges in that regard. We are hearing from local health officials around the state that the disease is now most commonly spread at social gatherings, face-to-face meetings of a whole host of contexts which involve our individual social lives. We see it happen sporadically across the region, and as a result, our weekly averages of the number of Washingtonians who are infected has continued to rise in a very disturbing pattern of continual, consistent increase. I want to show you the 7-day rolling average, which is 629 cases a day. This is the highest number throughout the entire pandemic. Now, I mention this because this might be a surprise to many of us who had the sense that after we were over the original hump, we would be in safe territory. Unfortunately, that is not the case. This has continued to rise consistently for the last month. Today, if I can show you another graphic showing the extent of the daily viruses per 100,000, infections per 100,000. The cases per 100,000 of our population are going up statewide as well, which you can see in this graphic. And you'll note that the rate of increase is quite significant. The angle of attack, if you will, of the line on the right going up is almost as steep as it was in the original days, and it is twice as high as during the first onset, if you will, of the virus. So here's what we know. This shows that too many individual citizens, regardless of their age or their ethnicity, are simply not exercising the caution that is necessary if we are going to arrest this very, very dangerous rise of this pandemic. Hospitalizations are also going up. Deaths are also going up. And we simply do not want to see scenes in Mukilteo or the Tri-Cities or in Olympia that look like Arizona and Texas today. In those states, those communities are having to bring in refrigerated trucks for people who've lost their lives because of the onslaught of this pandemic. And if these trends were to continue in our state, at some point we would be in that situation. And that is not anything but reality that we face right now. So if we are disturbed of the scenes we're seeing in those southern states that opened up their businesses much earlier than the state of Washington, we simply have to find another strategy or additional strategies to arrest this pandemic. So today we are acting to take action in that regard. Here's what we're going to do today. Social gatherings of 5 will remain in effect for those counties that are in phase 2 and modifies phase 1, which is in most of the state today. But today I'm announcing a change to those counties that are in Safe Start phase 3 and those counties that someday could be in phase 3. This will limit all social gatherings to no more than 10 people a week. And that is something that we simply have to do if we're going to arrest this pandemic. Additionally, we are prohibiting all live entertainment, indoor and outdoor. Now, that's tough. We understand this. But if we are going to reduce movement of people and cut down on the number of face-to-face contacts, these are necessary and reasonable decisions that we have to make. The orders will go in effect Monday. I'd like to, if I can, talk about the social settings that are now of such concern to us. Here's what this means. Basically, it means that you really can only be with 5 people outside of your household in about 80% or 85% of the state. And in those relatively small numbers of counties that are in phase 3, it's only up to 10 people in those counties. And these are individual things that we all can control. And when we do that, when we do have those meetings, social distancing is absolutely imperative. Doing things outside is so much safer than inside. And of course, wearing masks are absolutely pivotal in our success in any and all of those social get-togethers. Now, there are exceptions to this change that won't be affected, at least for right now, including spiritual services, weddings, and funerals, which act under our existing guidance. So anything more than 10 from outside your household is not allowed in phase 3, and in phase 2, anything more than 5. And I do want to emphasize, even limiting the number of people that we socialize with does not remove or reduce the imperative nature of mask and social distancing. So just a note on the kind of things we're talking about. You know, this is somewhat of a challenge for us, because the kind of things that we have always treated as benign and innocent and healthy during the decades of our lives are now dangerous. Hosting backyard barbecues with too many people that would violate this order is now a danger. Having a picnic with too many people that violates this order is now a danger. Dining in a restaurant with too many people in dangerous circumstances can now become a danger. Birthday parties where people have become infected at innocent things like a birthday party. And I say these things because it's difficult for us to understand that. But as governor, I really have a responsibility to share with Washingtonians the thing that is creating deaths in our state, and it is these innocent social get-togethers. There's a story in today's Seattle Times that illustrates this problem perfectly. A couple in Tacoma had done everything right. For months, they were taking care of themselves. But they had a few close friends over in late June. It turns out one of them had COVID, transmitted to this couple and others before they knew it. That's the type of thing that we all have to be on guard against. So we cannot let our guard down, even as we engage in more activities. Now, I know this has been a long and frustrating process for all of us. We all have our individual stories. Mine is I haven't had a chance to hug my new grandchild, a little beauty named Annie, who I get to see her crawling now electronically, so I still get to enjoy her company. But it is hard not having a chance to give her a hug. But if we're going to save ourselves from increasing death, it's simply what we have to do. Now, there is a particular phenomena that is now occurring in our state, too, which I have to address. And that is that we have had a really significant surge in COVID cases among younger people. I'll give you an example of that. From January to March, young people represented 22% of COVID cases. From May to June, they represented 45% of our cases. We are seeing an explosion of this pandemic in the younger generation. And we know that while younger people may not have the same rate of bad events, they can suffer them. Just as I was walking in here, I saw a story about an otherwise healthy 29-year-old who had lost his life. I heard a story of a person in Washington had to be intubated yesterday, healthy 25-year-old. So somehow we really need folks in this age group to help us, help themselves, but help the rest of us too. And I'll tell you why. Even if young people were totally immune from this disease, right now, when they infect someone, they may not have a particularly significant problem. They, in fact, may not suffer symptoms at all. But when they go home and visit their parents or their grandparents or their uncle or their aunts, boom, they become a virus vector. And we, unfortunately, have to anticipate an increased rate of hospitalization as this young cohort of folks spread out through their communities and through their families. So we really need the young generation to lead us, and there are leaders. I spoke to a group of leaders from colleges and universities yesterday or 2 days ago who had a really good idea about how to say, look, there is hope for us. This is not something we can give up on, that young people can help protect those of their own age group who are immunosuppressed. They can wear masks. They can protect themselves when they're doing the essential business, and we know that young people do more of the essential business that does expose them more to potential viruses. So we know we can succeed on this if we have the younger generation who will lead us. Some may correctly note that these prohibitions on gatherings are largely self-enforced. So far, not aware of anyone being cited so far, even if we know there hasn't been total adherence. So allow me to make the meaning of this more explicit. If individuals, each of us, do not adhere to mask wearing, do not adhere to social distancing, do not adhere to these limitations on gatherings, today's rollbacks may be a forerunner to additional rollbacks. And we cannot rule out the potential for another stay-home order this year, and perhaps not in the too distant future. So how individuals respond to this crisis will determine what happens to all of us combined. These are individual acts of community responsibility that can save us all. And as I've said before, we don't have a vaccine, but we do have each other. And we're asking all of us to protect each other right now. Masking and social distancing and limiting your contact, as this order will require, all together are our best defenses against this virus right now. We have some hope on the horizon. You may have read about some promising results from some vaccine trials right here in Washington State. But those are not in the immediate future. And all of us now have certain weapons that we need to use. You know, I want our students to go back into the classroom. I want our restaurants and businesses all to be open. I want our state budget so it's not hemorrhaging billions of dollars. And I want people to be healthy and long-lived. And we can accomplish those things if we abide by these simple principles. And we're calling Washingtonians to do that today. So with that, I'll turn it over to John for some comments. John.
Great, thank you, Governor. Really appreciate your leadership on this issue. I know public health people I've been talking to all across the state really appreciate the attention to the social gatherings that you're talking about, and appreciate the reduction in the number of folks who we are saying one should interact with in any given week. But we do know we're going in the wrong direction, as your chart showed. That's the case. As a matter of fact, on that chart you showed, Governor, about our rate being 115 cases for every 100,000 population in the last 2 weeks. That's actually doubled in the last month. So when you were talking about that rise there, that's actually double from June 9th to July 9th. And that's really concerning to all of us, and it's something that's saying we should stand up and take attention to that, and not only take attention, but take action. You know, everything that we do as individuals, when we go to work, when we recreate, when we're being social, all of those things impact our ability to move forward as a state with the things that we want to. And we really can't go safely forward unless we all do our part. And there are many things at risk to this, as you say. We have at risk schools opening in the fall if we don't, with in-person classroom, if we don't get a handle on this, because right now it is just simply moving in the wrong direction and going to be too dangerous if this continues. So really this is about the impacts that we can all make and pitch in together and do that leadership that you've talked about for so long. So I know that we don't want to jeopardize any of the momentum, but we are jeopardizing the momentum and the gain that we made with the stay home, stay healthy order. So as you said, really what we need to do is decrease the number of people to contact with in those social environments in particular. In talking with the folks in local public health and who are interviewing the people who are diagnosed with COVID, what we're hearing is it's these social interactions that indeed folks are starting to see become more apparent in the cases, including now we're seeing some of the impacts of the July 4th weekend activities. You know, it's now about 2 weeks later, and during that time period, that incubation period, That's when we would be seeing the cases, and the people who are talking to the people who are recently diagnosed are learning a lot about these interactions, as you talked about, whether they're birthday parties, a cocktail party, something that people feel is pretty innocuous. So we all need to pay attention. I think the bottom line is our attention to this can't be a part-time job. This is a full-time job. Every interaction we have to think about doing it safely, wearing those face coverings, keeping our distance. And if we do that, we can bend the curve again. And it's absolutely essential that we do that. So thanks, Governor, for your words around this and the leadership we're taking today.
You bet. And that word leadership is important. I will note that I think all of us have some leadership capability here. You know, whether you're a parent of a 19-year-old that wants to go out and party during the night and is going to be with 50 other people, look, there's a leadership position. If you're a 19-year-old and you're going to go to a party and you think, you know, maybe that's not the best idea to not be socially distanced, that's a leadership position. And we're really hopeful people do show leadership. Lastly, I'd like to draw attention to the fact that Congress needs to pass another stimulus bill. They need to do it now. We have so many people who need financial support now. They're making good use of the extra $600 in their unemployment benefits, and those need to continue, and Congress needs to move to do that. We are hopeful that Mitch McConnell timeline for the aid is not followed because it'll be too late. We need assistance now. This pandemic is not going to go away by the end of this month. We know that, and neither will the need for aid, both for individuals and for states so they can do their business. People need help. Businesses need help, communities need help, states need help. So I have one simple message: pass the damn bill so we can do our job and take care of our people. With that, I'd like to stand for questions.
First question comes from Rachel with AP. Governor, you've warned of potential additional rollbacks. Can you give specifics of what activity could be modified short of a stay-at-home order?
Yes, these are not decisions at the moment, but we would have to look, if this trends continue, even in the short term, if these trends continue, we would have to look at the things that are least problematic for people's daily survival, least essential for our economy, and most dangerous by bringing people together in social settings. Clearly, those would involve bars. Those could involve indoor dining at restaurants. They could involve other recreational activities, you know, bowling alleys and the things like that. The things that were the last things that you know, we had to shut down would be the first things we'd have to go back on. And why? Because science may dictate that. And the science is that this is a trajectory of tremendous danger and fatalities that we're on today. And we will have to be confident that our new measures of masking initiatives, this restriction, additional restrictions on social gatherings, and evidence that businesses are complying with the masking requirement would be enough to reduce this rate so that we can go about opening our schools and the like. And, you know, at the moment, that's a great question. So we're taking action in the last few days in our masking requirements. We're taking action today. But I just have to make sure people are aware that something has to change fairly significantly, or we're going to be back been to the soup just like we were in March and April.
Rachel, would you like to ask a follow-up? Yes. Schools, you spoke with School Superintendent Reichdahl yesterday. Can you just talk a bit about what that discussion entailed and whether there were any decisions made?
So there were not any dramatic decisions made. We talked about the status of the school district discussions and planning primarily. I talked to a number of superintendents yesterday morning and then the superintendent yesterday. And as you know, basically he and the departments of health have set forth templates about how to go about education in this fall. And they set out basically some requirements that we will need to meet in order to be able to do that. Requirements about distancing of students, of hygiene, of screening of people. And so we know what those requirements are, and the school districts are now considering those to figure out how to go about education in the most successful way, taking those into consideration. And at the moment, it doesn't appear that those plans are set in concrete. We know that many of the districts are looking at hybrid plans that would involve a certain number of days in classroom instruction and certain remotely. There's also a number of school districts have told me they would consider an option where parents, if they wanted to, could opt for remote instruction. And there may be some schools that have found a way to do it with total on-site instruction. So at the moment, the situation is districts are trying to make individual decisions that are consistent with their own community settings, and that those discussions are continuing. There are discussions with a variety of the community, parents, educators, and the leadership of these school districts. So the state is continuing to try to figure out what works on a community by community basis. But I do want to perhaps reiterate what is maybe obvious. Our ability to open schools is dependent on our ability to knock down this virus. And as you noted, we're getting some good science on this subject to make scientifically driven decisions, because that's how we make decisions in the state of Washington. And following that science so far has been a very wise decision by the state of Washington, because we have avoided the horrendous scenes like we see in Arizona of people who've lost their lives having to be stored in ice trucks because the morgues were full. And because we have followed science, we have avoided those scenes in the state of Washington. So we're going to continue to follow that science. I saw a comment from the White House that they weren't going to let science get in the way. That's been an unfortunate attitude that is extremely dangerous. So that's one of the reasons we're acting today, to notify people that changes in social behavior are absolutely imperative in increasing the odds that we can have more on-site instruction in our schools. And I hope people help in that.
Next question comes from Joe with the Seattle Times.
Governor, a two-part question for you. Regarding today's order, is this a signal that you view the larger gatherings as more of a threat in the Phase 3 county compared to the 5-person limit in the Phase 2 counties? Is that not a threat at all in your mind at this point? And then, you still have lawmakers unhappy that there hasn't been a legislative session scheduled. On the Republican side, there are, a host of concerns, constitutional, but even some Democrats want to get back to Olympia. How do you justify keeping one of the three co-equal branches of government sidelined during this extraordinary pandemic so far?
So in answer to your question, no, I consider the restrictions that we have equally important in Phase 2 and Phase 3 counties. We hope that this order regarding Phase 3 counties is a reminder to everybody else in the state of Washington in Phase 1 and Phase 2 that these social activities now are becoming increasingly the causative factor of this disease. And as time goes on, this becomes more and more apparent. So we have done some things that have been proactive and successful in our business environment of hygiene and masking and telecommuting and the like. But what we have found is what we have gained perhaps in the business community, we have lost in the social setting. So each is equally important. I hope that this decision today will reverberate to all of us, because the things that we have found so typical and normal, today what used to be a birthday party can be a death sentence for somebody. And that's just a reality. And as time goes on, that becomes more and more apparent. So hence the decisions today. The need for a session, we do not need a special session right now. And the reason is that we have enough financial wherewithal to get to January where we can have a regular session with all of the good work that legislators can do. And the reason we are in that position, we believe, is because we have a $3 billion reserve account that is available, and we are hopeful that the Congress is going to act. And if the Congress acts together with our reserve account, those decisions may be relatively easy for this biennium come January. But it is not necessary to have a session right now, and there's no reason to have a session just to have legislators talking amongst themselves. Second, we don't know yet what our financial really underpinnings are, because we don't know what Congress will do. And it could be a $2 billion difference whether they act or do not act. And it doesn't really make a lot of sense to have stewing and arguing and speechifying when we really don't know what the fiscal position of the state of Washington is. And the third reason is I have asked legislative leaders, and it is clear to me is that there's not a consensus or a way to pass a budget in some way that has majority support in both chambers. So for those three reasons, we look forward to success with legislators when they return in January, and I'm going to work very closely with them.
Would you like to ask a follow-up?
Oh, that's fine. Thank you.
Next question comes from Essex with Cairo.
Well, let me note, if I can add, can I add just something that to Joe's answer that sometimes is forgotten? The other reason this is not necessary is that the state has already taken considerable actions to respond to the revenue downturn. I vetoed about $445 million of spending that I supported, that was new spending that was passed in the last session of the legislature. I supported 98% of that, but I had to veto it because we did have to do some things to tighten our belts. I also instituted a measure to save about $55 million in payroll with a furlough program that could grow to over $90 million if other statewide officials follow my lead. So we have already taken some action, and that is one reason why we are in a position to have these discussions in January rather than August.
Essex, you can ask a question now.
Yes, Governor, because it's so important, why have you exempted weddings, funerals, church services from these new restrictions?
We are hopeful that people will embrace this call for action in their social lives in these less structured settings. And I believe in listening to the local officials. It is these less structured settings where we're getting the huge increase in infections. It's the 20 people at a beach party, and I love beach parties and I love young people. But when I see 20 young people, not masked, shoulder to shoulder, it's dangerous. It's the folks in my generation who are going to a retirement party and have 20 or 30 people in a house. Those are the things that we think are the things that have increased in the last several months. And look, I understand why those things have increased. We are desperate. We are longing for human company. We want to see our friends, our relatives. It is such a natural thing, particularly after this length of time. But we in Washington understand that if you're going to win a battle, sometimes you have to be in the battle to the end. And that's the situation that we are in right now. So those social settings is where we think some of the biggest transmission has been. Now, this does not eliminate the possibility that we will have to impose the same restrictions on those more formal settings at a later date. And as I've reiterated, unless something changes, we will have to make more decisions that are difficult. So we hope everybody bears down right now.
Would you like to ask a follow-up?
Yes, a follow-up question for Secretary Wiesman. Knowing what you know about the numbers and the fact that school's going to start opening in 6-7 weeks or so, should school districts be focusing more of their time on figuring out how to do remote learning and less of their time on trying to figure out how to do it in person?
Well, what I really hope people focus on is that they focus on at the moment about what each of us can do individually to help assure that kids can attend school in person and do the things that we've asked folks to do. And as the governor said, those things are things each of us can do and take responsibility for. And as we've also said, we know the need for social interaction and want to continue to encourage people to do those Zoom happy hour parties or birthday parties where people can stay connected. And then if they are in those small gatherings, to make sure they're wearing their face covering and making sure they're keeping their distance. And, you know, it's prudent for schools to be planning for the whole spectrum. And I think that's what they're doing. That's the right thing for them to do. And again, we can do our part by helping them be able to get kids into the classroom by 100% of our time taking responsibility for our personal interactions.
Next question comes from Jerry with the Everett Herald.
Thank you.
Governor, the White House coronavirus task force received a report this week, state-by-state analysis, and for Washington, it recommends and suggests moving to some pool testing, some community-led neighborhood testing, and some changes in the process. Are you folks considering that?
Yes, there are several of our local labs in the state of Washington that are considering that. In order to do that, they have to get the approval of the federal government. So the sooner the federal government gives us approval of that, the sooner we can use this pooling strategy. I spoke to one of the commercial labs yesterday about this, the CEO of one of the commercial labs, who also believed that this makes sense. This makes sense when you have lower rates of transmission. We do think that in certain of our communities, we have a low enough rate of transmission where pooling makes sense. So yes, we are considering that. We're in the process of getting approval for embracing that strategy. And the faster the federal government helps to approve that, the faster we can embrace that strategy.
Jerry, would you like to ask a follow-up?
Sure. As another, looking at this report again, there's also a suggestion to government should look at innovative ways to monitor compliance with some of the restrictions. I'm wondering, in light of today's announcement, what innovative ways might you guys be considering to enforce the gatherings beyond the voluntary compliance?
Well, I think one of the innovative ways we could do it is to stitch a mask around the president that is permanent so that he does not continue to create deceit, dysfunction, and disengagement so we can go about saving lives. That would be handy and quite innovative. Now, we would only do that with his concurrence, of course, but I say that, tongue-in-cheek, but look, we could use some national leadership here. That would be innovative. We're starting to get a more bipartisan approach in our state and across the country. Mitch McConnell, Republican senator, is wearing a mask. Congressman Dan Newhouse, Republican congressperson from Central Washington, wearing a mask. Multiple Republican mayors across the state of Washington, including Eastern Washington, are wearing masks. I want to give credit to some of those leaders, Commissioner Delvin in Tri-Cities and others. Our most recent survey in Benton County and Yakima showed a huge increase in those that are wearing masks, and they have been innovative in a mask up campaign that is bearing fruit. In Yakima, the usage was only about 35% about a month ago. There's one survey showing it's up to 95% now. That might be overly optimistic. But the point is, we have a lot of local leadership. It'd be nice if we had national leadership on this subject. As far as the innovative ways to make this work, we have been innovated. Our state was the very first state, I believe, to create a requirement that businesses not serve people who are not wearing masks. Other states are now following that policy. I think Michigan may have done that yesterday. So that is innovative. And we will have a communication effort that has or will shortly begin to talk to all the communities where they live about why this is helpful. And I think you'll find some innovative way to message that. So we're an innovative state. We're going to be innovative throughout this program.
Next question comes from Drew with King 5.
Good afternoon, Governor. Do you have confidence that schools can make campuses safe for reopening, whether it would be this week or in September? And if you had school-age children, would you feel comfortable sending them back to a school anytime soon?
Well, I have grandchildren, so they're a pretty good proxy. I'm confident that the local districts are really exploring all the options to do this in a safe way. I think there is a possibility that they can do that, particularly in this hybrid model, which would give schools a way to spread children out. It may mean they only have 2 or 3 days in class, but they have remote the rest of the time. I think that does have promise. So I would not rule out the ability to have some on-site education for kids I care about. But again, this depends on the progress of this pandemic. And if we want our kids in school, the fewer people in bars, the more kids are going to be in school. And that's what this is all about right now. So we remain very hopeful. And I do want to say, I think the districts are really exercising thoughtfulness and creativity. I've seen some things where people have stretched to do things differently, to explore every part of the school building that they could use. Obviously, improving remote learning opportunities is really important, and they're being as creative as possible. But we have to realize remote learning is not always totally equitable. Children without great broadband access, children with disabilities, it's much more difficult for them. One of the things that I talked to one district the other day about is to have children with special education needs be in the classroom 5 days a week so that they would not be jeopardized by having to go remote. That sort of made sense to me. I just want to tip my hat to the districts trying to work through these very difficult challenges.
Drew, would you like to ask a follow-up?
Well, if your grandchildren's districts did feel safe to open, you would send them back in September?
Yeah, yes, I think they're going to make reasoned decision. And the district that my grandchildren are in are providing them a crackerjack education that is wonderful. The work that the educators are doing, I can't tell you how thrilling it is. I'll give you an example. I have an 8-year-old granddaughter. I was talking to her the other day, and we were talking about what she likes to do. Well, she likes to write. And I said, well, what kind of writing do you do? And she says, well, you know, I do narrative writing. I do objective analysis writing. I do advocacy writing. So there are many different styles of writing, and I do different types of styles depending on what day I'm in and what the context is. I mean, I might have learned some of that in my 3rd year of law school. I'm blown away at the education young people are getting, and I am impressed with what educators are trying to do right now.
Next question comes from Jim with the Spokesman Review.
Governor, I'm wondering, how long will you wait to gauge whether these latest rules are effective, or you might need something else, considering that the chances to see what's happening from exposure to infections on next Monday when these go into effect, they may not show up for 2 weeks, given the time it takes for symptoms to show up and then tests to be processed.
These are the questions that are unanswerable. I can't give you a specific date. What I can tell you is every single day we evaluate these situations. Now, this morning I had some news that was very concerning. There's preliminary numbers of infections announced today, over 1,000 for the second time in about a week. We don't have the full date when those infections took place, so we don't know to what date to really ascribe those. With an over 6.5% positivity rate, which is higher than it has been in the last month. So this morning's data was disturbing to me, and we just look at that every single day. So I can't give you a date or a time. It's when we make a decision that we have to be more aggressive to have a higher level of confidence that we're going to knock these numbers down.
Jim, would you like to ask a follow-up?
But just to be clear, you won't be waiting weeks to make this decision, it doesn't sound like.
Not necessarily. Just not necessarily. We could make a decision tomorrow if we saw some things in the data that made it clear that that was the right decision. Or it could be weeks before there's additional changes. You just have to judge this on the condition of the patient. It's like asking a physician, when are you going to make the decision to do the surgery? It depends on the condition of the patient. And we hold 7 million people's lives in our arms, to some degree my arms right now. And I take that very seriously. and I evaluate it every single day. And we're going to make decisions based on science, not ideology, or trying to avoid hard decisions.
Next question comes from Keith Wiscoma.
Yeah, Governor, as far as the numbers that are coming out, just looking at Pierce County, 89 new cases. When you were allowed them to go to phase 2, they were averaging in the teens. When is it going to be time for you and the Secretary of Health to take some of these counties and force them back back phase 1 or phase 1.5?
I would give exactly the same answer I gave to the previous question. When it's the right decision, that we are confident that what we are doing are not achieving the desired goals. And today we're taking some action that will increase the ability to reach those goals. Tomorrow we may have to take some more action depending on what additional metrics are coming in. So I would tell you that we will make those decisions at the right time. And I think by and large we've done that throughout this effort. And so all I can give you is the value statement that we use in making these decisions. And those values remain unchanged. We value human life, we value science, we value fairness. And when those three things suggest we need to move, we will make the right moves. And we are not timid or afraid about controversy. That's deadly right now, to be afraid of controversy. We have to act sometimes. So at the right moment, we will take further action.
Keith, would you like to ask a follow-up?
Governor, we were at Lake Washington over the past several days, and there were large groups of young adults who were out on the pier, out on the boardwalk. Some of them told us they just don't care. What do you tell them, and is it time to take more stronger enforcement of your mask order and your crowds order?
Well, I got to tell you, this is a difficult thing to talk about because I'm 69 years of age, and when I see young people, I'm immediately jealous of them being in perfect health, the bloom, the rose of youth, with not a care in the world. You know, I'm kind of jealous of that. And the last thing I want to be seen is the guy saying, "Get off my lawn." I don't want to be in that position. And you can't ascribe the whole problem to the young people of the state of Washington. Look, one of the reasons they have a higher infection rate is they do a lot of the work that's on the lower end of the pay scale, where they have a lot of interaction with people. They're the people serving you coffee and ice cream at the grocery store, and so they're exposed more than the older generation. So I'll defend them to a certain degree. However, the fact is that we are simply seeing a behavior that is way too risky, exactly the kind that you're talking about. I'm seeing it many, many places that I go, and it's really troublesome to me. All I can tell people in that situation is that the greatest motivation I would hope you would have is if you really don't care a lot about your own life, and if you think the odds are with you, fine, but you're taking that home to your mom and your dad, and you're taking that home to your grandpa and your grandma. And if the life of your grandpa and your grandma or your mother doesn't motivate you, then I don't know what will. And I just hope that people start thinking about that a little bit. It's one of the reasons we're taking action today. And it is the motivation to help your loved one that eventually is going to get people to show some responsibility. If people don't care about their grandma, then heaven help you. I can't help you. You're helpless. And I just hope people start to think about in those terms. Now, could there be enforcement action? Yes. So far, it has not been really useful to do that. We are taking some enforcement action against this business in Chelan County. If businesses don't enforce the masking order, there could be enforcement action in those contexts. But for individuals, this is an individual issue of who you love and who you care about. And we hope Washington show that in the next few weeks.
Time for a few more questions. Next question comes from Alexis with the News Tribune.
Governor, can you respond to the Trump administration's order that had to do with hospitals bypassing the CDC when reporting patient information and what that might mean for our state?
Well, it is very disturbing because the administration under this president, unfortunately, has a history of first denying the problem, then disengaging from the problem, and then trying to deceive the public about how bad the problem is. And so when they do something like this, it's very concerning. The CDC is the group charged with this responsibility. I can see no reason to deny them access to this information, which are the experts on this, other than some motivation that is unpure. Now, unfortunately, I shouldn't say unfortunately, we know the president views himself in great political trouble, but that should not justify denying the public the protection of the information that is the most important information, intelligence information we have right now, which is how to beat this pandemic. And this information is gold. Look, the decisions we make on a daily basis depend on accurate information, much of it from the CDC. So we should all be very disturbed by this. We would hope Congress could act on this to try to save us from a person who doesn't want to know us how severe this problem is. And that's a sad fact right now.
Alexis, would you like to ask a follow-up?
No, thank you.
Last question. Great. Final question comes from Ashley with the Chinook Observer.
Hi, Governor. I'm wondering, last week I asked about why there wasn't a closure to the state's coastal beaches ahead of the 4th of July holiday. And you'd said that there wasn't really a serious discussion on that topic. And you mentioned Ocean Shores, which is actually in Grays Harbor County, but and I'm in Pacific, but was a good example because since last Monday, Grays Harbor has seen an increase of 22 cases, raising its total number of confirmed cases to 56. Long Beach is also part of a pilot program to map our COVID-19 spread by testing our sewer systems. The day after the 4th of July holiday, up till 4th of July, our sewage tests did not detect SARS-CoV-2, the virus that causes COVID-19. But on July 5th, the day after the 4th, the sewer test showed an estimated about 30 people in the city were shedding the virus. So I'm just curious, why wasn't there more serious discussion about closing the beaches prior to the holiday, given how popular a destination the coast is for the 4th of July?
Well, I guess one reason is that I'm not omnipotent. We're doing everything we can to save lives, but I haven't been able to have a decision-making for every 100 yards in the state of Washington. And, we just did not consider that being at that level of risk that justified additional decision-making that was specific to the ocean beaches. But you raised some really interesting information. I had not heard that information you just shared with me. I'm going to go back and ask the health departments about that. And it might be a situation where it does call for additional closures at a later date, depending on what the data shows. And this comes back to what I've been saying, is that we follow the data. You've just given me some data points I find very, very interesting. So I'll be doing some checking on that, and I appreciate you sharing that with me.
Ashley, would you like to ask a follow-up?
Yeah, I do just have one follow-up question, Governor. I think you raised a good point that you said that, I'm not omnipotent, and that you can't plan for every 100 miles of Washington. And, Pacific County is a rural county. It's 22,000 at, the top of its census. But our legislators are really informed on the issues that are important to us down here. So I guess I would just go back to say, wouldn't that be a benefit of having the legislature in session, that you would have these people who live closer to these counties that your staff just couldn't possibly have the capacity to know every detail or every issue that's concerning to the area?
No, it would not be, because there's nothing special about a special session that already doesn't exist. The legislators can pick up the phone and call me anytime. The mayors can call me at any time. The county commissioners and executives can call me at any time. I don't recall any of those local leaders urged us to close the bridges before, or the beaches before that. I will check to confirm that, but I don't believe any of the local leaders requested that before the July 4th. I will check on that, but we have open communication without the necessity of a special session. The phone system is working and works really well. So I will check on that, but I don't think, Now, that may change. You've just given me some information that might give us a new viewpoint, including some of the local leadership. So we'll continue to look at that.
All right, any final words, Governor?
No, I want to thank everybody. Just wash your hands and mask up and care about your grandma. Thanks a lot.
All right, everybody, we're going to stay in the state of Washington, but now go to King County.
So I think that one is also really important right now. So I would like to see those two added to our list.
Well, Councilmember Lambert, aging in place is on our list.
Okay, but I thought it was in the resolution. Isn't this a resolution that we're only doing the ones in the resolution list?
No, ma'am. Please see page 30 in your packet.
That's where I'm looking.
Okay. Additional items for board consideration as possible.
Okay, so great. So then I don't understand the
aging in
format.
place.
That's okay.
That's in the same section that you were citing the duplication of mental health and suicide prevention for veterans.
Okay, so then it threw me off was a potential action having checks. And I was looking that the checks were appropriate. So then aging in place is on. And then for the duplication of the veterans, that we take the 4 veteran duplication out and just have mental health and suicide prevention for everybody. So we take the duplication out.
Okay, there is a duplication that I've spoken about having a deep
Let's talk about
clerical correction and then add.
All right, everybody, I'm not too sure that this is coronavirus related. So we're going to head on over to the state of Maryland, where they were talking about unemployment earlier today.
Good afternoon. Thank you all for being here. Joining me are Maryland Labor Secretary Tiffany Robinson and Special Agent Derek Pickle from the U.S. Department of Labor, Office of the Inspector General. We're here to announce that the state of Maryland has uncovered a massive, sophisticated criminal enterprise involving widespread identity theft and coordinated fraudulent unemployment insurance claims in Maryland, involving more than 47,500 fraudulent claims and totaling over $501 million. The state of Maryland exposing this illegal scheme and notifying the federal authorities has helped shed light on related fraudulent criminal activities in at least a dozen other states. I want to congratulate Secretary Robinson and her team at the Maryland Department of Labor for their incredible efforts. After detecting an unusual increase in out-of-state federal pandemic unemployment assistance claims, the Maryland Department of Labor discovered these more than 47,500 fraudulent claims, which were involving massive identity theft, attempting to utilize stolen identities and the personal information of innocent and unsuspecting individuals, which was apparently acquired from previous national data breaches. Our Maryland Department of Labor immediately notified our federal partners, including Maryland U.S. Attorney Robert Hur, as well as the Office of the Inspector General at the U.S. Department of Labor. And we have been coordinating with them on this ongoing investigation. Yesterday, I spoke with U.S. Attorney Hur, who praised Maryland's decisive actions. Thanks to the efforts of our Labor Department, not only did we identify the fraudulent activity here in Maryland and save the taxpayers $500 million, we also helped the federal authorities uncover related illegal activity in states across the country. I want to praise the Maryland Department of Labor, the Office of Inspector General, and the U.S. Attorney for their work. And I also want to assure the people of Maryland that the state of Maryland Department of Labor has not experienced any breach of our unemployment insurance information system. And Maryland claimants' personal information has not been compromised in any way. Maryland was the first state in the nation to establish a comprehensive website with the capabilities of processing unemployment benefits for both regular unemployment claims and the CARES Act unemployment programs. That comprehensive website at the Maryland Department of Labor has helped us successfully process over $4.3 billion in federal unemployment insurance benefit payments to more than 489,000 Marylanders who desperately needed that assistance over the past few months. In the Great Recession of 2008, it took 18 months to reach that number of claims here in Maryland, which now the department has had to handle in just the past few months. It is equal to the total number of claims in the previous 3 years in Maryland added together. The department has successfully processed 96.4% of all the claims in Maryland, and the percentage of cases that they are still working hard to help people resolve is down to 3.6%, which is in fact even lower than normal pre-pandemic processing levels. But we're committed to ensuring that all unemployed Marylanders get the help that they need and that they receive every single penny that they're entitled to. Some had suggested that we compromise the integrity of these federal programs and that we just pay out benefits regardless of whether it is a legal claim or whether or not an individual is eligible. That would have violated state and federal law, and it would exploit innocent taxpayers. This criminal enterprise seeking to take advantage of a global pandemic to steal hundreds of millions, perhaps billions of dollars from taxpayers is despicable. And we will continue to work with both the U.S. Attorney and the U.S. Department of Labor Office of Inspector General on this ongoing investigation, both here in Maryland and in other states across the country, to do whatever it takes to ensure that the perpetrators are apprehended and prosecuted to the fullest extent of the law. Detecting and stopping this fraud ensures that money remains available in these funds for the tens of millions of deserving people all across America who actually need the help. And I can assure you that nothing is going to stop us from continuing to help struggling Marylanders get the assistance that they need during this crisis. This time, I'd like to turn it over to Secretary Tiffany Robinson from the Maryland Department of Labor to discuss her team's efforts to identify and stop this fraud and how our innovative Maryland Labor website allowed us to uncover this massive criminal fraud scheme. Secretary?
Good afternoon. Thank you, Governor, for your leadership and for your support through this investigation. Since the beginning of the pandemic, our federal partners have consistently and strongly warned unemployment insurance programs about the prevalence of fraudulent and criminal activity. As states across the country continue to experience unprecedented volume of claims, fraudsters are capitalizing upon the hardships created by the pandemic and are targeting unemployment insurance programs due to the additional benefits offered by the CARES Act. The PUA program in particular allows individuals to self-certify that they are unemployed due to the coronavirus, eliminating the employer check and balance that exists under the regular state UI program and increasing the potential for fraud. In fact, a recent spike in criminal activity led the FBI to issue a national warning about fraud in the unemployment insurance system. while quickly paying unemployment benefits to eligible claimants has been of the highest priority, we have also been committed to maintaining program integrity to ensure that both taxpayers and claimants are protected during these already difficult and uncertain times. Knowing that fraud was a real and ever-increasing threat, our department's employees remained vigilant. And when our Division of Unemployment Insurance recently detected an unusual increase in out-of-state PUA claims, we were prepared. With a secure website and heightened security measures in place, our department quickly detected, reported, and blocked payment to over 47,500 fraudulently filed out-of-state claims. The immediate actions taken saved taxpayers over $501 million, the most significant unemployment cost savings in the country announced since the beginning of the pandemic. I'm so proud of my team for working around the clock to allow our department to emerge as the victor rather than the victim of fraud. Our department will continue to coordinate with the U.S. Attorney's Office and the U.S. Department of Labor's Office of the Inspector General to investigate and prosecute the criminals taking advantage of the PUA program by filing fraudulent claims using stolen personal identities. While U.S. Attorney Robert Hur could not be here with us today, he stated, "My office and the entire law enforcement community are committed to bringing justice to fraudsters who are preying on citizens during this unprecedented public health crisis by using their stolen personal information to fraudulently attempt to obtain unemployment benefits. We are grateful for our partnership with the state of Maryland in stopping unemployment fraud and believe that this joint federal-state partnership will continue to bear fruit. We will continue to work together to prevent this abuse, as well as continue our outreach efforts to make the public aware of COVID-19 scams and frauds. I urge citizens to remain vigilant and to report suspicious activity or fraudulent use of their personal information." I'm grateful for that statement by U.S. Attorney Hur, and we also appreciate our strong partnerships with the U.S. Attorney's Office, the Office of Inspector General, and our vendor, Bank of America. I want to be very clear that the Maryland Department of Labor has not experienced a breach of our unemployment insurance system, and claimants' personal information has not been compromised in any way. We have already taken a series of actions to even further enhance security, and we will continue to closely monitor our unemployment insurance system out of an abundance of caution to prevent any further fraud from occurring. If any Marylander believes that their information has been used to fraudulently file an unemployment insurance claim, they should contact our department's Division of Unemployment Insurance by emailing ui.fraud@maryland.gov or visiting mdunemployment.com. Since the beginning of the pandemic, like every state, our department has faced a series of challenges. As the governor mentioned, we have received more claims in just the last few months than we received in the past 3 years. We created a brand new online application in a matter of weeks to administer 3 new CARES Act unemployment programs while navigating the ever-changing federal guidance directives. Our department has overcome these challenges and made significant progress in the processing and payment of claims, paying over $4.3 billion in benefits to claimants. And in the midst of it all, our team successfully blocked payment to over $500 million in fraudulent claims. We remain committed to helping Marylanders through this pandemic, which means ensuring that all eligible claimants get the benefits they deserve as quickly as possible, while also protecting the integrity of our system and your taxpayer dollars. We will continue to build upon this positive progress and will not stop until each and every customer has been served. And now I would like to introduce Special Agent in Charge, Derek Pickle, from the U.S. Department of Labor's Office of Inspector General, who has been working alongside our department as we fight fraud. Thank you.
Good afternoon. Thank you, Governor Hogan and Secretary Robinson, for inviting me to be here with you today. My name is Derek Pickle. I'm the Special Agent in Charge of the Washington, D.C. region for the U.S. Department of Labor's Office of Inspector General. The Office of Inspector General is the law enforcement agency primarily responsible for investigating fraud in the unemployment insurance program. And we take great pride in working with our law enforcement and state workforce agency partners to accomplish that part of our mission. Since the pandemic began, we have seen a dramatic increase in the amount of unemployment insurance fraud occurring throughout the nation. To give you a sense of how that spike corresponds to our work, unemployment insurance fraud investigations have historically made up approximately 10% of our agency's investigative workload. Today, more than 50% of our investigative matters pertain to unemployment insurance, and that number continues to grow by the day, and that includes investigative matters in all 50 states. Over the last many months, the Office of Inspector General has prioritized working with our state and federal partners to combat fraud being perpetrated against the unemployment insurance program. A major focus of that work has involved the collection and analysis of unemployment claims data in order to identify fraud indicators and move proactively to address fraud and prevent the loss of taxpayer funds to criminals who seek to exploit the system for personal profit. Today's announcement demonstrates the strength of our partnership with the state of Maryland, the U.S. Attorney's Office, and offers an example of the kind of result made possible through our shared commitment to safeguarding taxpayer funds and ensuring the integrity of the unemployment insurance program. In closing, I personally wanted to commend Secretary Robinson and her team. The diligence exhibited by your personnel in identifying this fraud and bringing it to our attention was outstanding, and we look forward to our continued accomplishments through that partner. Thank you.
Well, I want to thank you, Special Agent Pickle, very much for joining us here today. And again, I want to thank the U.S. Department of Labor, Office of the Inspector General, very much. I want to thank the U.S. Attorney and our entire team at the Department of Labor. Processing the sudden and unprecedented increase in employment claims while following complex federal regulations and guarding against fraud is certainly not an issue unique to the state of Maryland. The federal government and every state in America has had to overcome challenges to handle this recent overwhelming caseload. Over the past few months, America has seen an unprecedented economic collapse never before seen in our lifetime. And Marylanders have not been immune to this national economic collapse. Here in Maryland, however, we were able to keep more than 70% of our state economy open throughout this entire crisis without shutting down. And then with our safe, effective, and gradual roadmap to recovery, 62 days ago, we were able to lift our stay-at-home order in Maryland. And 41 days ago, we moved into stage 2 of the recovery plan. Maryland is open for business, with 98% of our economy open and able to operate in a safe way. Because of these decisions and actions, our unemployment rate, while obviously considerably higher than it was before the pandemic, is much lower than the national rate, far better than most of the states in America, and is the very best among all the states in our region. On Monday, I led my 44th call with my fellow governors in just the past few months. It was our 29th call with either the president and or vice president. Yesterday, we also convened the 20th meeting of our coronavirus recovery team of leading public health experts, doctors, scientists, and business and labor leaders. And we held another emergency meeting of my entire cabinet. As we continue to navigate through both the health and economic crisis, our key health metrics in Maryland continue to remain low and stable. Our daily positivity rate dropped again today to 4.26%, and our 7-day positivity rate dropped again today to 4.49%, which is a more than 83% decrease since its peak 90 days ago on April 17, when we were at 26.91%. We did see a slight uptick in COVID hospitalizations today, but they are still down 73% from their peak 77 days ago on April 30th. However, we are concerned that 40 states across America are experiencing spikes in increasing numbers, including states just across our borders. And we're watching a few concerning trends in our state. The positivity rate among Marylanders under the age of 35 is now 83% higher than Marylanders who are 35 and older. And an increasing number of COVID-19 cases have been connected to noncompliance with public health requirements, particularly in bars and restaurants. Yesterday, I sent a letter to county leaders urging them to enforce public health requirements in bars and restaurants across the state, reminding them that it was the responsibility of their local health departments, local liquor boards and inspectors, and local law enforcement agencies to work together to actively and aggressively enforce these critical public health measures. Young people should avoid crowded bars, house parties, and large gatherings of any kind. You are not only putting yourselves at risk, you're also risking the lives of your parents, your grandparents, and other vulnerable people in the community. Any Marylander who has been engaged in any type of risky behavior should immediately get tested for COVID-19. We are also advising that Marylanders refrain from traveling to areas that are experiencing rapidly escalating numbers. Any Marylander who has traveled to or is returning from travel out of state, especially from those states that are experiencing spiking numbers, should immediately get tested. I want to remind Marylanders that while our health metrics are continuing to slightly decline or plateau, this battle is not behind us, not by a long shot. Only you can stop the spread of this virus. All Marylanders are still safer at home, but particularly older and more vulnerable populations. Low risk does not mean no risk. Outside activity is still much safer than inside activity. Employers should continue to encourage telework for their employees when possible, and individuals who can work from home should continue to do so. Marylanders should not use public transportation unless it's absolutely necessary. Everyone should continue wearing masks in public areas, businesses, and on public transportation. Marylanders should continue practicing physical distancing, staying 6 feet apart whenever possible, and should continue avoiding all large gatherings. Our economy is open, recovering, and doing better than many other states. But only you can keep Maryland open for business by continuing to follow the public health guidance. While other states are beginning to experience serious testing shortages, here in Maryland we do not have that problem. Back at the end of April, we laid out a long-term testing strategy. Last month, the signature state lab we built at the University of Maryland, Baltimore, became fully operational. So we're now able to handle our own large-scale testing. And unlike many other states, most other states, we have a substantial strategic stockpile of COVID-19 test kits that will keep us in good shape all the way through the fall as the normal flu season begins and as the demand for COVID tests increases. Finally today, I want to address a major issue that is on everyone's minds. What action the State Board of Education will take regarding our schools. We all want our children to get back to school as soon as possible, but only if and when we can do it in a way that keeps our students and our teachers safe. Last month, Dr. Karen Salmon, the State Superintendent of Schools, and the Maryland State Department of Education put out Maryland Together, Maryland's recovery plan for education. Since that time, they have been meeting with county boards of education, local school superintendents, teachers, parents, and key stakeholders to collaborate on and develop detailed, safe, and effective recovery plans for all our Maryland public schools. A few counties have already begun submitting their proposed plans. Other local jurisdictions are continuing to work to finalize theirs in order to meet the August 14 deadline. Once all of that input is received, the State Department of Education will institute protocols that follow CDC guidance and take into account the input of public health experts and which provide for flexibility for our local school systems. We cannot and should not rush this decision. It is absolutely critical that we get it right for our communities and for each and every one of our children and our teachers. Dr. Karen Salmon, the State Superintendent of Schools, will join us for a press conference next week in order to update us on the progress the State Department of Education is making and on the state's education's guidance. In closing today, let me just say that this crisis has tested all of us in nearly every way imaginable. But with the help of Marylanders coming together, we have been leading in the fight against this deadly pandemic by flattening the curve, by reopening our economy safely, and today by detecting criminals who are trying to exploit innocent people for their own gain. From the beginning, we have all been in this together, and although this is far from over, and it will not be easy, we will get through this together, and Maryland will come out of this stronger and better than ever before. With that, I'd be happy to take a few questions.
I talked to someone last week who was the victim of fraud, and several people who said all of a sudden my debit card was canceled. So I wanted to know what exactly the fraud rate was detected, how many of the frozen accounts were verified fraudsters, how many were legitimate people, and when do you anticipate returning funds and reopening accounts for those who are legitimate?
So the frozen accounts were all out-of-state folks that we stopped the payment on the debit cards to stop the $501 million in fraud, the 47,500 criminal fraudulent accounts. A few real people who really needed benefits got caught up in that because we had to put a hold on all those payments. But the department is working diligently to process them as quickly as possible, and I think it'll be very, very quickly they'll get those resolved. Now that we've cleared out the 47,500 cases of fraud, I think those folks will be taken care of right away. They had to freeze all the out-of-state accounts in order to conduct the investigation. What's that?
Do you have the exact number for approximately?
It's a very small number. The total number of all the outstanding cases is only 3%, which is far lower than our normal monthly average in a normal year. So it's very small.
There was mentioned some other states are involved. Do you know how many, and maybe name some of them?
In talking with Special Agent Pickle and U.S. Attorney Herr, there is no question that all 50 states and all the territories have been hit with serious cases of fraud, totaling billions and billions of dollars. The cases that are directly or involved in this same thing that we're involved in helping to uncover, that our information is helping in the investigation of, is 12 other states, a dozen other states.
Hey, Governor, roughly a month ago, Secretary Robinson, speaking to a legislative panel, said that the state had not yet, to her knowledge, been a victim of widespread fraud like they had seen in states like Washington. When exactly were these cases of fraud discovered?
We can't get into all the details of the ongoing investigation, but it was relatively recently we caught the fraud, which just happened. Just over the July 4th weekend, and immediately notified federal authorities, and we can't give a whole lot more detail than that because the investigation is really just beginning.
And this has nothing to do with the subpoenas that the federal government served on states looking for unemployment fraud?
Well, the federal government has put out warnings all across, it has nothing to do with a subpoena, but they have put out warnings all across America, warning about fraud.
Governor, on July 6th, we reported a Maryland man whose identity was used by someone in Florida to obtain unemployment
Yes.
insurance.
I saw that report, actually.
It took him several weeks to get the attention of the Department of Labor, him and his company, which is why he contacted us. On July 2nd, I asked for data on this.
Well, we'll have Secretary Robinson follow up with you directly, and I think we'll have her call that person directly and try to get that case solved. Again, it's 489,000 cases that have been resolved with the $3.8 billion. It's an enormous. It's hard to talk to 489,000 people at the same time, even if you have hundreds and hundreds of additional people that you've hired. But I'm both of us, the Secretary and I both said, any one person that's not getting money that they deserve, we want to try to get to the bottom of, and that's why we've got it down to far less than what's normal. But there are 3% of the people still in process. We could deny all of those people, and then we'd have 100% compliance. But we're working very hard, even though they haven't qualified yet or they've got some issue. I can tell you the department is working day and night to try to get those people the help they need. And those folks that had their identity messed up, I think that's going to be resolved right away. It was just, this is all coming to a head in the last few days.
Governor Hogan.
You've expressed some frustration with young people and with fraud. And we are seeing an increase in the numbers. Are you considering any sort of rollback?
Well, so this is a problem all across America, and in my discussions with the other governors and with the White House, it's come up repeatedly. A number of other states, many other states, opened bars without restrictions. This happened in Florida and Arizona and Texas and Mississippi. They're all closing bars now because this infections are out of control. And they all believe that they all have the same problems with the young people, and they all believe they have, through contact tracing, trace it back to bars. But they have hundreds and thousands of people jamming into these places. We never opened bars like that. Our bars were only supposed to be open for seated, distanced, capacity restricted. 90% of the restaurant owners in the bars were following the rules. People would go in, they could have dinner, they could get a drink, you could sit at the bar. Some of them were completely, blatantly not following the rules. We're really concerned about our small business owners. We're concerned about those people who work in those restaurants. We want to get people back to work, we want to get our economy, and we want to keep people safe. So at this point, we're trying to crack down on the bad apples without killing the entire industry and all those folks that work there and causing more unemployment. But look, if this gets out of control, if people continue to not follow the rules, we'll have to take another look. Right now, we believe it's a small percentage of the people, maybe 95% of the people are doing it right, both the businesses and the individuals. And the ones who aren't, we're going to try to get our counties to enforce the rules that have been in place for months and people just aren't listening to.
Governor Hogan, might be a question for you or anyone else up there.
I think Special Agent Pickle, who was not allowed to answer questions on the ongoing investigation and didn't want to get into all of the Corona stuff, has already left. And
Okay, well, I'll ask you this. Have you been able to identify how much may have been paid out to these fraudsters before you detected the scheme? And do you believe this is one entity, and do you believe it's a foreign entity, not a foreign group that's targeting the U.S., or do you think that bad actors coming from inside?
was great questions. I had the exact same questions. We don't have an exact number on it. I'm sure some has slipped through that we didn't catch, but I think we caught the bulk of it all, and we'll follow up and get to the bottom of any fraud cases that we were not able to catch. We don't have a number on that. It is obviously a coordinated criminal enterprise, because this is not, just random people in their basement that stole somebody's identity. It's 47,500 fraudulent identities in Maryland and 12 other states. It's billions of dollars. It's a large, sophisticated criminal enterprise. Because of this ongoing investigation, which has just begun, not only can I not say the answer, I don't know the answer, but we know that there was a similar case that involved a Nigerian crime ring, and not to say that this is in any way connected, but it could be international, it could be organized crime in America. We just don't know the answer to it. But it's not just a random individual. It's very sophisticated. It appears as if, and we don't know the specific where it came from, but we had a breach of the federal government system a while back, an OPM. We had a breach of Experian and a number of banks, and this was a huge cache of people's identities. Did not come from here, and we don't know where it came from, and we don't know, who's responsible yet.
Governor, quick question, please. In regards to the letters sent to county leaders and without bars and restaurants, have you heard back from any of them? And if you see numbers continue to go up in certain jurisdictions, you send another letter saying we'll find them all set?
So the letter just went out yesterday, but our team has been in communication with a number of the counties already, and a number of people have already taken action. Well, first of all, I also want to take a moment to praise the Bar and Restaurant Association and many of the good operators. We had situations in Ocean City where 5 or 6 bars and restaurants immediately, voluntarily shut down as soon as they had some of their workers test positive. They really did the right thing. That's what we need everybody to do. A couple of places in Baltimore did the same thing. There were also a couple of instances around the state where people were flagrantly ignoring the rules. Montgomery County yesterday shut down 2 businesses. And there are a couple of others. So it just happened yesterday, but we're in our team that coordinates with all the local governments was in touch with everybody. They got the directive. I think they all are in agreement that we need to do something about this, and everybody's going to be working together. Okay.
What role will the state police have in compliance with this?
The state police has been in communication with all of the county sheriff's departments, county police departments, all the municipal governments, and sent out guidance. But the state police department is very small in comparison to the counties and the city police departments, and doesn't have the capacity to do that. It really is a responsibility of the counties, and the reason we sent the letter yesterday, it needs to be a coordinated response. What we were finding, one of the concerns we had from some of the local governments was the health department, the local county health department would say, well, it's our responsibility, but we're busy doing testing and we don't have people to go to the bars. The health inspector said, we don't know all those health rules. And the police department said that we don't have a citation for these new regulations. So we told the county leaders, get your county law enforcement, your county health department, and your county liquor boards together in one room and say, to find a coordinated way to enforce this. We don't care how they do it, but they've got to do it. It's not the state police's responsibility.
Governor, do you understand, as far as Dr. Karen Sam is concerned in reopening schools, are you pushing her to one decision or the other?
No.
And do you understand the frustration from both sides? The kids should go back, the kids shouldn't go back, the hybrid won't work, it will work. What are your thoughts on that?
I understand completely the frustration on both sides, and I think Dr. Salmon understands the input from both sides. I said the other day when the president was saying you must do this, you must do that, and I said we're not going to be bullied into moving in one direction or the other, and I mean that in one direction or the other. I really do think many people would love to see the kids get back to school. I certainly would, but I also don't want to send kids back to school if it's going to cause major issues. So they're going to take all the input, as I said. They're looking at the federal input from the CDC. We have our own state plan, one of the most detailed, more than 100 pages that came out more than a month ago. Might have been one of the best and earliest in the country. And we're working very collaboratively with all the county folks, and we're listening to everything. They're going to make the right decisions, and it may be some type of a hybrid. We may, figure out the best way. I don't know, and I'm not pushing because the State Board of Education is an independent body. Dr. Salmon works for the State Board of Education. She serves in my cabinet, but she's not appointed by me. And we want them to make the right decision for Maryland and for our kids and for our teachers. And I'm not going to try to unduly influence them.
Last question. Governor, you talked about rushing. You talked about not rushing the school's decision. Prince George's County today, one of the largest in the state, said they're going to go online the entire fall semester to reassess. Did they rush their decision, or are you going to know that there's a reassessment sooner?
No, they didn't rush the decision. The state plan requires the counties to come up with a plan no later than August 14th. As of yesterday, it was only Montgomery County and Frederick County who had come up with a proposed plan. I understand today Prince George's came up with their proposed plan. I haven't seen it, and I don't think the State Board of Education has seen it yet, but As I said, the plans all have to be in, all 24 of them, by August 14th. I'm trying to push to get that done faster because I don't think we should wait that long. Karen Salmon and the State Board of Ed is working with all of them. But I don't think any final decisions have been made in any counties. It's all going to work under with the requirements of the State Board of Ed. All right, thank you all very much.
We're going to stay on the school topics, everyone. We are now in Houston, Texas. The ISD stands for Independent School District. That's what all school districts in the state of Texas are called. So again, this is, of course, discussing reopening schools.
Of our commitment to safety, when you arrived here today, a school nurse checked your temperature at the door, and you were not allowed entry unless you passed our screening. I will share more about our safety measures in just a moment. I would like to thank our Board of Education throughout this entire process since March the 12th. And even as of a few minutes ago, they have been very supportive of me as a superintendent, supportive of the decisions that I've had to make, and in collaboration with them. And in April, the board approved 4 emergency constraints to set specific operating conditions and expectations for the district during the COVID-19 pandemic. The emergency constraints directly address operating expectations while schools were closed but educating students. The emergency constraints are as follows. The superintendent will not operate without addressing the social and emotional needs of our students. The superintendent will not operate without addressing the health and safety needs of our students. The superintendent will not operate without engaging students in learning. The superintendent will not operate without protecting the health and safety of employees. Based on what you've read thus far, what you've seen on the internet, whether it's on our reopening page and all of the information, I hope you can see that my decisions were guided by those 4 emergency constraints. Once again, thank you to the Board of Education for your support. Along with those emergency constraints, I provided the board with progress measures. When we meet in August, those progress measures will be updated and presented to the board. We have been working diligently to identify a plan that addresses the unique challenges brought on by our current health situation. Our goal is twofold: to deliver a quality education while ensuring the health and safety of students, families, and staff. With the safety of students, families, and staff as our top priority, all students will start the 2020-21 school year in HISD virtually on Tuesday, September 8th. Virtual instruction for all students will continue for the first 6 weeks, beginning Tuesday, September 8th through Friday, October 16th. My decision to begin the 2020-21 school year virtually and delay the start of the school year for 2 weeks was due to, number one, being a citizen in this community, being a leader in this community, being a wife, a mother, and a friend, and being the leader of over 28,000 employees. It touches me in every being and to the core of who I am as an individual. I've had many sleepless nights, even up until this morning, wrestling with this decision. But I need our children to be safe, but I need the adults that are charged with serving those children. I need them to feel comfortable coming to work, and I want everyone in our district to be successful. Additionally, almost 50% or more than 5,300 of the approximately 11,000 HISD teachers actually reside in the city of Houston zip code. Given the threat of COVID-19, we will not put the health and safety of our students and staff at risk. Currently, our plan is for face-to-face instruction for students to begin on Monday, October 19th, 2020, with a phased-in approach. However, this date is subject to change based on COVID-19 conditions across the city of Houston and recommendations from local, state, and federal health officials. Also, we might be able to extend the virtual instruction to longer than 6 weeks if additional flexibility is provided by TEA. I want to thank our governor who spoke out on yesterday and said that local districts deserve flexibility and control to make the decisions that's in the best interest of their communities. And I thank him, and we look forward to hearing additional information about that. Because it's important for parents to have the ultimate choice in determining what is best for their child, parents will have the option to opt out of face-to-face instruction entirely for the fall semester and for the entire 2021 school year and choose online learning. This week, HISD Board President Sue Dygard, along with 9 board presidents from large urban school districts across the state, sent a letter to Governor Abbott requesting greater local control and flexibility regarding student attendance, funding, instructional designs. As the interim superintendent of the state's largest school district, I support this effort. As the trustees articulated in their letter, school districts require stability to open without fear of financial losses and need flexibility to open school in a manner we determine is best for our community. Once again, I want to thank the governor for listening, and we appreciate his comments yesterday regarding the need for local flexibility in addressing student needs during this pandemic. Thank you, Trustee Dygard and members of the Board of Education for your leadership and advocacy for HISD students. Starting August 24th, parents will be receiving a phone call from the district asking them to indicate their preference for their child's education as it relates to online instruction beginning October 19th, whether it be face-to-face or online. Call-outs will be made in various languages on a school-level basis, accounting for multiple students in the same family at different schools. If families have multiple students at the same school, parents will select one choice and receive a follow-up from campus-level staff to confirm the same or different choices for each child at that campus. 2 weeks prior to the first day of in-person learning, there will be another round of call-outs for confirmed commitments. If there is no change, the initial choice will roll over, but families can use this opportunity to use the latest health data to make a new commitment. We are encouraging families to make that commitment for at least 6 weeks, which is a grading cycle. All parents will be asked to complete the 2020-21 Parent Introduction to Virtual Learning course by August the 28th. So we're encouraging all 209,000 parents in our district to complete that course. The course will be available starting July 31st. Once again, it's a Parent Introduction to Virtual Learning online. Communicating with parents and staff and soliciting feedback and input has been a priority for us throughout COVID-19. As we made preparations for a safe and strong start to the 2021 school year, it was critical to gather feedback from district families and teachers regarding experiences with virtual learning and in the spring to 2020, and how schools should look in fall 2020. We gathered feedback through a COVID-19 response parent survey and a teacher survey. Over 66,000 households completed the COVID-19 response parent survey, and over 7,300 teachers responded to the teacher survey. Participants were surveyed in the areas of district communication, desired instructional format for 2020-21, internet access and technological needs, and support available at home for students participating in virtual learning. Of parents surveyed, only 21% indicated that they would be comfortable with in-person instruction as normal, while others, over half, agreed with continuing with virtual learning only. Of teachers surveyed, only 14% of respondents indicated they were ready to physically return to the classroom. The first day for HISD teachers will be August the 24th, when they will report virtually. All other district employees will continue to work virtually and will be notified by their direct supervisor regarding the date they will be expected to return to the office in staggered phases. To ensure learning is uninterrupted and continues virtually, the HISD academics team has developed an instructional continuity plan. The plan provides a robust framework that expands on the current HISD at Home, which is our learning platform, and provides additional guidance and support for any future extended periods of closure. As the district gets the guidance from state and federal officials, we may implement changes to this plan. TEA has provided guidance on 2 virtual learning models, synchronous and asynchronous learning. During the first 6 weeks of the 2020-21 school year, Houston ISD will be implementing asynchronous learning. Asynchronous learning allows students to work at their own pace, while teachers will be available to provide live support and intervention through a daily instructional support schedule. During periods of virtual learning, students are expected to complete assigned learning activities each day. To support students and families, the plan includes opportunities to train and develop students in utilizing district resources, as well as training geared toward parents and how best to support their students. Grades will count. Grades will count. Starting Tuesday, September 8th, grades will count. Attendance and participation is a must. Attendance and participation during virtual learning is a must, and grades will count. Special population students will continue to receive services, technology, and needed accommodations. Admission and review and dismissal, or ARD committees, will continue to meet to determine the unique needs of students who receive special education services. Parents will continue to attend ARD meetings virtually and will receive support from a special education case manager to ensure that individual student needs are met during virtual instruction. The Social Emotional Learning, or SEL department, will offer webinars in both English and Spanish, focus on ways students, staff, and family members can maintain social and emotional health. Professional development will also be offered to school staff to ensure classroom teachers and school leaders are better equipped to support students in crisis. Campus-based counselors, social workers, and wraparound support specialists will continue to perform outreach to students and families. Once face-to-face instruction resumes as a primary safety measure, all HISD students and employees will be screened daily before entering any HISD building, just as you were today. They will also be required to wear appropriate masks, wash their hands frequently, and adhere to physical distancing requirements. It will be mandatory for nurses, custodial staff, food service workers, and select special education staff to wear gloves. Everything will be provided. The district will be providing all PPE for staff and students. The district will provide enough hand soap, paper towels, tissues, and hand sanitizers and disinfectant to accommodate frequent cleaning of high-touch areas. HISD will adopt a flexible attendance policy so students and staff aren't penalized for staying at home when they are sick, have a sick family member, or have been exposed to someone outside of the household who is sick. These protocols were developed by our HISD Communicable Disease Plan Task Force. I want to thank all the members that served on that task force. We had over 60 members of our community to serve as it relates to this committee. The group worked diligently this summer to identify ways HISD could return students and teachers to classrooms and employees to office workspaces while following public health guidelines and mitigating transmission of COVID-19. The task force was charged with reviewing safety guidance from local, state, and federal health and education officials. We'll be re-engaging not only this committee, but also our Instructional Continuity Plan Committee as we revisit the progress measures for our emergency constraints. We will be gathering those groups back to share with them the information around the proposed progress measures for our Board of Education. During the first weeks of virtual learning from September 8th until October 16th, curbside meals will be provided at select schools with enrollment of 60% or more of free and reduced lunches. These schools are considered severe needs. Also, during the first 6 weeks of online learning from September 8th until October 16th, students enrolled in HISD schools at select locations throughout the city will have meals delivered to their residents. With prior TDA approval, the district will identify those approved locations such as large apartment complexes, group homes, and even large mega churches. Employees will continue to accommodate student health, medical, and special dietary needs, as well as allergy concerns. Department employees will follow public health hygiene recommendations and enhance custodial cleaning and surface disinfection. Once students return face-to-face with face-to-face instruction. Transportation services will enhance cleaning protocols and implement physical distancing for all buses and buildings. Because physical distancing drastically reduces bus capacity, only special education, homeless, and priority students will be transported for in-person classroom instruction initially. The department will also implement contingency plans for responding to student bus routers and bus drivers who develop a presumed or confirmed case of COVID-19. Extracurricular activities will follow the same safety practices employed on school campuses during the school day. School-based extracurricular activities will resume when in-person instruction begins. Face coverings must be made available to and worn by students and teachers during all extracurricular activities. Student sporting events are tentatively scheduled for the fall, but HISD athletics will adjust plans as needed if COVID-19 conditions change. Field trips will not take place until the district has been advised that non-HISD locations have been deemed safe for students to visit. It is no secret that school districts across Texas and our country have been confronted by a technological divide. Despite our efforts and supports from community partners, this divide still exists in our district and city. As I've stated before, we estimated about 35% of households in the district do not have internet access. Additionally, 35% of respondents in our COVID-19 parent survey indicated they need better, more reliable internet. In our parent survey, 52% of respondents indicated they need technology devices for schoolwork. We will continue to close the technological divide by providing families internet hotspots and other devices like iPads, laptops, and Chromebooks. Through the district's Power Up program, all high school students received a laptop. During the spring 2020 semester, HISD had approximately 50,000 high school students that had their own device, and they will continue to have that device. The district has purchased a total of 35,000 additional devices and 6,000 internet hotspots for students. We will continue to work diligently to ensure that all students remain engaged as we begin virtual learning in September. Parents of students in need of a laptop or hotspot who have not yet received one from HISD, please contact your school principal and let them know of any technology needs before the school year begins. We will also be surveying all of our parents again to make sure that every child has access to a device for learning. We will ensure that every child remains engaged in virtual learning. So beginning in August, we will launch our Students Within Reach Return Strong campaign. As part of this initiative, beginning August 3rd, we will attempt to reach every child who was not engaged in virtual learning during the spring semester. Based on our data, we know that around 32 students were not engaged in the learning process during that time. We were able to reach all but 5,000, but all of them were not engaged. After the first day of school and every day after, students who have not logged in and started participating, we will be conducting home visits, we will be doing call outs, but our goal is to reach every child that is currently on our rosters and scheduled to begin on Tuesday, September 8th. HISD wraparound specialists and other trained staff will conduct home visits while maintaining physical distancing to attempt to reach every HISD student. As a part of our work to engage with families, the district launched the HISD at Home hotline. Students and parents can call the hotline Monday through Friday with questions concerning distance learning. We have operators answering questions in English, Spanish, Vietnamese, and Arabic. The hotline number is 713-556-INFO, 713-556-4636. Parents can start calling the hotline on August the 3rd between the hours of 7 a.m. and 7 p.m. That number again is 713-556-4636. Enrollment for new students will continue to be handled at the campus level. Parents should reach out to schools they're interested in enrolling their child in for assistance. Parents new to HISD who are interested in enrolling their children in a magnet or choice program may apply for programs that have space available. Also, we still have spots available for parents to enroll their child in pre-K. Please visit www.choosehisd.com or call 713-556-6734, 713-556-6734. 6734 for additional information or to request assistance. The registration process for the 2020-21 school year will begin on August the 3rd, 2020. You can also visit www.houstonisd.org/enroll. As a reminder and kind of a teaser, we're going to send some additional information out. I know that there's a concern that the delay of the school year by 10 days means that possibly students might not be engaged for 10 days. But during the weeks of August the 24th, which was the originally scheduled first day of school, through September 3rd, students will have the opportunity to participate in HISD enrichment opportunities. We will be sending that information out to all parents. K-12 students will have that opportunity. So there will be enrichment academic opportunities from August the 24th through September 3rd, with school beginning on Tuesday, September 8th. Again, I want to emphasize that students will begin the school year virtually for the first 6 weeks of school, starting on Tuesday, September 8th until Friday, October 16th. The safety of our students and staff is our number one priority, and we will reassess the situation before the planned face-to-face instruction on October 19th. I want to encourage parents and staff to visit our reopening landing page for more information about our district's reopening plan. I want to thank all members of Team HISD for your patience over these past 5 months. I want to thank you for going the extra mile to feed our students, to contact our students, holding webinars, going out, practicing social distancing, visiting our students, calling our parents, being available after hours for our parents to meet their needs. At this time, I will take questions.
You were just listening to HISD Interim Superintendent Granita Lathan giving the official announcement that the school year will start September 8th and begin virtually until October 9th.
The best of our abilities, we have shipments rolling in, and as those shipments are rolling in, we're deploying that equipment, and that is our goal, to get those in the hands of every child that needs a hotspot and or a laptop. Like I said, all of our high school students have it, and so they can also share with their siblings initially as we continue to roll out those devices. But that's our goal. Just don't tell my CFO, but no, that is our goal.
If you're not able to meet that goal, the state guidelines as of now require that you reopen the building so that you provide face-to-face instruction. If you do not meet that goal, you plan to provide face-to-face instruction.
So those are state guidelines. And as we look to see what additional policies and rules will come from TEA, we'll make that decision. But our goal is to be 100% virtually and support students 100% virtually.
Dr. Lathan, you addressed this at the beginning, but you can just say about the circumstances that need to be met for the district to say that it's just too risky to do in-person learning for students to be here, for faculty to be here, and that we can only go all virtually.
So currently, based on the conditions in our city, I believe we are a code red. We're on high alert. The reduction in the positive cases as it relates to the city of Houston. And, you know, even most recently, as we hear the number of deaths, that's concerning, but it will be slowing a course of the virus, reduction in the number of positive cases across our city. And then also guidance that we receive from our local health department in our city.
But what would you need? What kind of, if things continue to be bad, what circumstances then need to exist for you to say we can only do all virtual?
The circumstances that exist today, based on the high percentage of positive cases, based on the level alert that we are as a city. And so if those numbers keep climbing and they're still at this level or higher, that would be, for me, that would be a recommendation to go to the board, having them to approve a resolution to continue beyond that time.
Could you talk about the COVID gauge system that you plan on implementing? It's a color-coded system similar to what Harris County is currently using, and how that's going to play a role in education.
Yes, thank you very much. And thank you once again to our Communicable Disease Committee. That came out as a result of the committee's work of mirroring what we are as a level or our gauge levels, similar to what the county has shared with us. Because what happens in the county impacts HISD, what happens in the city impacts HISD. And so that's why we mirror that. And so we will look at the conditions in the city and county and compare that across the entire district. But there are possibilities that on October 16th, we reopen face-to-face. There are possibilities that some campuses will close. So some campuses might be on red, where we would just need to close that particular campus, and other campuses would remain open based on the needs of that particular campus if there are no positive cases and no issues there.
Yes. You were saying that starting August 24th, parents will get a call saying, do you want your kids to participate in the October 16th in person? And then they get another chance before that date to change their mind?
Yes, and the reason we're doing that because as conditions change, it's too early now because we know today if we send it out, like I said, we just completed and ended the survey on July 2nd. And so as conditions change and things get better, so a parent on that particular date might say no. And then a couple weeks later, the conditions have improved and they might want to change their mind. And we want to be supportive of that parent's decision.
And whatever they decide, they need to sort of stick to a 6-week time frame. Right?
Yes, we are highly encouraging parents to stick to that because, staffing is built on the number of seats that enroll and number of students that enroll and participate. And so that's a master scheduling nightmare if people are going in and out. And so that's why we're asking them to do that at the beginning of a new grading cycle.
You also mentioned that parents, if they want to, they can do online learning the entire school year. I mean, is there anything where that might change that wouldn't be possible or no?
I doubt that would change. Like I said, I believe this is the year of flexibility, 2020-21. I believe it's the year of flexibility. I believe it is truly the year of allowing parents to make that decision based on their own health, their level of concerns around the health of their child or their family. But I don't see us changing. So our goal is to provide that commitment that we will provide online learning for the entire 2020-21 school year. Homeless students, yes, priority.
What about those parents who are working jobs, more than multiple jobs, and they want their kids to be here, their kids want to be in school, but they're having a difficult time with the transportation? What do you say to those parents?
I think that's an excellent question. What I say to those parents is when we send out that information, we're going to do what we can to work with parents. And as we look at those numbers of who's selecting face-to-face and who's selecting virtual, we might have to provide opportunities for modified days where we have half of the students spend a certain amount of time, and then or we extend that particular day. And so we're going to do what we can to work with parents to ensure that we can get students to school. That's the number one goal when we're ready to go face to face.
For the parents of younger students who may not know how to use a computer, what resources will be provided so that they can guide their younger children?
Thank you. So number one, we're encouraging all parents to participate in our parent orientation to virtual learning. Number two, HISD staff members, not only our wraparound specialists, but other staff members whose job at this point would just not allow them to work remotely at home, will be assigned responsibilities to help get students online, to walk them through. So you dial this particular number, Granita is going to walk you through, okay, Jacob, he's sitting right there, Jacob, this is what you need to do. But we're going to set up, and I'm calling them academic angels, that they will be assigned to support, especially our younger students and our families, because I know, and like I said, in making this decision, all of us have to work. I'm at work today also as a parent, but I just want to make sure everyone is safe. But I know parents have to go back to work, and we're going to do what we can to support them and support their child.
When you open buildings, will you require all teachers and other staff to report to the buildings, or will you allow some to stay home, even if they don't have a legally required accommodation that you have to offer?
Well, as an employer, we have to follow our procedures as it relates to decisions that staff. So we have we have FML, we have accommodations committee. So we have a procedure or process that staff members can go through to make that decision, and we'll be looking at that on a case-by-case situation. There will be, let me finish. There will be some teachers that will be assigned to continue to teach at home virtually, regardless of the circumstance, based on how we've identified by campus, how many campuses need a teacher to support them students virtually, or teachers will be assigned to be district-wide virtual teachers, but they could also be at home. So those who, and it still needs to be fair in that process that we utilize for teachers to self-select and think about it as you go through and apply for a position. If they select to participate or be a virtual teacher, we still have to have a process in place. That makes it fair to all of the employees that we serve.
So there will, but you do expect that there will be some teachers who, just say, I want to stay home because I have a family member at home who's high risk. There are other districts that are saying everybody has to come back unless you have a legal accommodation. We're expecting to make some accommodations for those, even who don't have a legal right to that.
So we're going to follow the legal process as it relates to that process, but there will be some teachers assigned or staff members to work virtually. But there's still a process, a series of questions, a series of things that need to be met in order to do that. But you just, with a district of 209,000 students, you can't just self-select. So yes, when we say it's time to report back, then we will look at that, and we'll look at that across campuses. And that's why one of the other things that we're doing is we've selected right now, we have 18 model campuses. And if you think about what is a model home or a model apartment, when you're looking for a home or apartment or looking for something, you go out and take a look at it, right? So we're going to use those 18 schools, and we're staging those schools now so as lessons learned, so we can prepare for all 280 of our campuses to be prepared to receive students. So the desk, everything is laid out, the teacher supplies in every classroom, the process from when you actually, like you saw today, walking up the sidewalk into the building, so you know what the requirements are. So we're staging and setting up those campuses, because I want, as a former principal, I needed my teachers to be comfortable. And so we want staff members to be able to come in and say, this is what your classroom is going to look like. Yes, you will have the cleaning supplies. See, it's already here. Because I know as a teacher, we buy, and teachers always are buying things, and sometimes we're running out. But we're going to ensure that we have everything we need to support our teachers and our principals to open up the school year face to face.
When you start back in person, will like all the students be in the same room all day long? How will that work?
A great question. And so we're looking at schedules, more of teachers moving as opposed to students changing class and moving. Our instructional continuity committee, that's something else that they looked at. But things are going to vary from campus to campus based on the size of those campuses. Right now, I'll give you an example. Our standard elementary classrooms, we went out and we've looked at some campuses. They can get about 9 students. If you do physical distancing of 6 feet, about 9 students in a classroom plus the teacher. If we do 3 to 5 feet, it's about 16 students in the classroom. And then if we move into a cafeteria, it's about 32 students in a classroom. So think about that. Our classrooms at the elementary level are 22 to 1. And so we can only get 9 of the 22 in that particular classroom. And so we're going to have to look at all those options. And that was going back to the question about transportation, is how do we schedule the day? But we are mandated to meet so many required minutes per day for our students. And so it's going to take a lot of flexibility over the next several months. But we're going to do right by our children, and we're going to do right by our staff.
I know this has all been real difficult for you all, but like, what's been the most difficult part of trying to make all this happen?
That's a good question, because it's been so many. Honestly speaking, it's always the worry around people's safety. I mean, even when we're not in the middle of a pandemic, it's that worry. It's that worry of any misstep. There could be grave consequences for that. And so that's been the worry. And down to even thinking about the transportation piece is, we are a district that transports about 60,000 students daily. And to say we might have to limit transportation initially, that's painful. The other decision is not to hold face-to-face instruction. Our students and our staff members, people think about are looking at our students. But I can look at my staff members and I know when they're having a good day, or are you laughing? I can look at my trustees and know that too. So as a teacher can see his or her student and know what's going on in their lives, that's the worry right now is, and I'm saying to myself, honestly speaking, Lord, it's 6 more weeks of keeping my babies at home. And so that's why I've told members of Team HISD, we are going to reach students. We're going to make sure that they are safe, that they're fed, and that they have what they need. And so that's been the difficult part, just knowing it's a longer amount of time away from their classrooms.
In terms of state funding, how is HISD being affected at this very moment by choosing to do virtual learning?
Well, right now, we are okay. We'll see what happens in the next several weeks. But when you think about finances, everything is around the expenses that we've incurred as it relates to the COVID pandemic. If you think about the amount of money we've already spent to buy additional technology, which we know it was definitely needed, the cleaning supplies, the extra staff, having to fog campuses, that money could be utilized for academics. It could be utilized to support students. So that's the greater concern, is having and getting reimbursed at 100% for all our COVID expenses. And see, since we have our Congresswoman here, I'm just looking at you and saying 100% reimbursement for our COVID expenses. So that's what we need the support, is reimburse districts. Allow us to do what we need to do and what we do best, which is educating children. For HISD, it's about educating the whole child, but support us with the decisions that we need to make locally.
And are some teachers being trained at this moment to be ready to jump in case the teacher isn't capable of doing his or her duties?
Great question. So we've provided professional development. We started professional development in the spring. We've provided professional development this summer. We will have start another round of professional development. We'll be also utilizing and training our associate teachers. Some people call them substitute teachers. So they will be available. We'll be providing training for them and opportunities for them to also support their campuses. Our principals will still be able to hire academic tutors to support students even in the virtual environment. We have several models. So we have so right now, the school day is 7:30 for elementary students, 7:30 to 3 o'clock, and high school and middle school, 8:30 to 4:10. So that is the standard. So then we have another version that shows if we need to bring in a certain number of students at a certain percentage of capacity, here's what that schedule will look like. And so we have various models that we have already put together, and it's just a matter of pulling that contingency plan and implementing it when it's time to go. And that's one of the things I want to make sure, and I know I've shared with trustees one-on-one, is we've thought about every scenario possible, but of course sometimes you can't hit 100% of them, but we're prepared in the event that we need to change and turn on a dime again, to continue in virtual or to come back face-to-face, whether it's 100% or even in phases where we look at pre-K2, we look at 6th grade, we look at 9th and 12th grade initially. So we have a combination of plans that we're ready to implement.
Why did you choose to start after Labor Day, and why did you choose to set a target return or target open date of mid-October?
6 weeks. So we're, like I said, we're on a 6-week grading cycle. So if you look at September 8th through October 16th, that will give us a 6 weeks. And I'll be very honest with you, it's around what's happening in our community. And there were about 2 weeks ago, and it's probably 3 weeks ago now, Judge Hidalgo talked about in one of her press releases where they had compared other states and other cities as it relates to when there's a major peak in the virus, and then how many days it takes from that peak to go down. Now, that was about 3 weeks ago, and we're now going in the opposite direction. So when I started looking at that, I contacted her office and asked for a copy of the data that she shared at the press conference, and we started looking at that as a team and saying, okay, and we're playing a game, of course, trying to calculate, okay, if we peak here, if this is a spike, then if it goes down, if we have about 40 days, of course, that's off now. And so that was one of the reasons. Number two, delaying the start. If there's flexibility to continue with online so that we can receive 100% funding, it helps us starting later if we have to go beyond that, the middle of October.
Do you expect you will have to add add minutes to your day, or potentially days to your calendar through Dallas has talked about spring break into June?
Yes, we will have to add those 10 days to the end of the calendar, and additional 10 minutes to our school day. So an additional 10 minutes to the school day, and then the last day of school now would be June the 11th. So we will need to add those days. But I'd rather have the benefit of adding those days and everyone is safe than not.
Did you say, does the move to be in a level 2 instead of a level 1 before you start that in-person school?
Yes, we would definitely take that into consideration. Like I said, in consultation with our local health officials and looking at that data, that is one major piece that we would take into consideration. And I know some people ask, well, why are certain districts doing one thing, other districts? Everyone is doing what's best for the community that they serve. And so it's nothing wrong with any decision any superintendent has made that's in the best interest. All of us have surveyed our communities. We've looked at the data. And so we're doing what's best based on what the data is telling us for our community.
This kind of depends on UIL, but if UIL is allowing some type of activity, some type of games for high school students in particular, will they be able to practice? Will they be able to, it's a little unclear from you guys, will there be practice going on in September and early mid-October?
Everything will be based on, if UIL sends down rules that says, yes, you can condition and practice. But once again, if we are still a level 1 as a city, we will not be allowing those practices. Because if we're still in a virtual format, we still have the same health challenges. And believe me, from a former athlete, I understand, I get it, but we have to all be careful.
All right, guys, just want to say thanks again for being here with us on coronavirusnow.com, also with Fox 10 Phoenix on our YouTube page. News Now does stream in multiple different locations, all to bring you the latest news that happens across our country. What I'm going to do is play a coronavirus special that was sent to us by one of our sister stations. This one's coming from the East Coast. It's going to be coming from our Fox 5 Atlanta team, and we're going to play it for you right here on News Now.
Authorities report nearly 3,900 new COVID-19 cases and 37 deaths in Georgia in the last 24 hours. Even so, some students will still be heading back to school in person with no mask mandate. As Fox 5 Alex Whitler reports, one Fulton County senior is taking matters into her own hands.
Sydney Harrison says she's done the math and believes it's possible to provide a mask for every Fulton County student.
It's not just parents who are concerned about their children's health and safety as schools consider in-person learning this fall. Rising Fulton County School senior Sydney Harrison says she wants to experience campus life, but she wants protection from COVID-19 too.
It's worth it as long as people are safe.
Harrison says she's not satisfied with the county's decision to recommend masks as opposed to mandating them.
If they're going to push the school systems to reopen, that they need to supply the necessary resources to do so. If they don't, we're going to end up in another lockdown, and I don't think anyone wants that.
The school system's website states, if face-to-face learning resumes, students will undergo random temperature checks. Masks are expected on school buses and strongly encouraged during school, and additional protective equipment will be housed in school clinics and when serving medically fragile students. Harrison, who was disappointed when her junior year and marching band plans were upended in the spring because of the virus, says that's not enough.
I just thought maybe I can do something that'll get the whole community involved.
So she calculated the cost of supplying masks to every student in the Fulton County School District.
A pack of 50 is around $20. So if you divide that amongst the students, it's roughly 40 cents a kid.
She says she'll keep close tabs on the developments with the school, and no matter the outcome, mask mandate or not,
All money raised will go toward keeping students safe.
If the county does end up mandating masks, the money will still go towards providing cleaning supplies and masks to private institutions or different teachers.
If you're interested in more information about Harrison's fundraising efforts, head to fox5atlanta.com. Alex Whitler, Fox 5 News.
Meantime, a group of former CDC directors has accused President Trump of undermining the CDC's response to the COVID-19 pandemic.
The four physicians wrote an editorial in the Washington Post claiming no president's politicized the agency's science the way that President Trump has.
All right, it looks like we had just a little bit of a player issue there, so let me get us back into our content. I've never had this happen before. My clip absolutely just disappeared. So let me just jump past that first story that we just brought to you about schools, and we're going to play it from the beginning of this.
Meantime, a group of former CDC directors has accused President Trump of undermining the CDC's response to the COVID-19 pandemic.
The four physicians wrote an editorial in the Washington Post claiming no president's politicized the agency's science the way that President Trump has. The Fox Medical Team's Beth Galvin spoke to one of those physicians.
Former CDC acting director Dr. Rich Besser says he was surprised to hear the CDC will no longer have access to COVID-19 hospitalization information. The Trump administration now says will be rerouted to a Washington, D.C. area database.
Yeah, I don't get it. You know, here we have in Atlanta the nation's public health agency, the world's leading public health authorities, and they're taking away exactly what the CDC needs, which are data.
Besser, now with the Robert Wood Johnson Foundation, is one of four former CDC heads who've written an editorial in the Washington Post saying the Atlanta-based agency is being sidelined by the Trump administration's push to move on from this pandemic.
I know so many people who work at CDC and work at state and local public health departments, and their morale is taking a hit. We're seeing public health officials across the country, we're seeing are having their lives threatened.
The president has been critical of the CDC's guidance on getting students back to school, saying it's too expensive and complicated. Besser believes Americans are caught in a political tug of war between two very different messages about the pandemic.
Where every public health leader in the nation is saying the same thing. This is a very dangerous pandemic. What we do individually and collectively really matters. And it's early days. And that's being contrasted by some on the political side who say there's nothing to worry about. Let's just get back to work and back to our social lives.
Politicizing the pandemic, Dr. Besser warns, will cost lives.
You know, when I wear a mask, what I'm saying is I care about you and your health. And I respect you. And when you wear a mask, you're saying the same thing to me. And if we can't get that to be the American way, if we can't get the politics out of that so that it's a political badge of some kind, whether you wear a mask or not, we're in deep trouble.
For your Fox Medical Team, I'm Beth Galvin.
New tonight, one White House official released this statement on the issue, saying, quote, the White House and the CDC have been working together in partnership since the very beginning of this pandemic to carry out the president's highest priority, the health and safety of the American public.
Well, we begin with some breaking news from the U.S. Department of Labor. It says the number of laid off workers seeking unemployment benefits last week remained at 1.3 million. The resurgence of the coronavirus and new business shutdowns in states such as Florida and California has intensified fears that the economic recovery is losing steam. We'll continue to follow that. Meanwhile, Governor Brian Kemp has overruled local leaders who issued mandatory mask laws. The sweeping action revealed in a new executive order issued late Wednesday. Good day's Emily Ikeda joins us live from the state capitol with reaction. Good morning, Emily.
Good morning, and I should point out Governor Kemp continues to urge Georgians to wear masks, stressing the importance of face coverings, but he doesn't think they should be mandated, and he made that crystal clear in his latest executive order. Governor Brian Kemp extended the state's COVID-19 guidelines late Wednesday, including bans on gatherings of more than 50 people and protections for the medically fragile. But this time around, his executive order tackles the feud over mask mandates head on, suspending any local ruling requiring face coverings in public. That includes those out of Atlanta, the governor's hometown of Athens, and several more Georgia cities. The first hint of impending action from the governor in a scathing tweet last week, Kemp calling Mayor Keisha Lance Bottom's stricter orders unenforceable, adding, quote, if the mayor wants to flatten the curve in Atlanta, she should start enforcing the current provisions of the governor's orders. Meantime, Johns Hopkins University unveiling a new tool tracking the COVID curve in each state. As you can see, Georgia is slightly pink, meaning cases are still rising. The darker the shade of red, the higher the increase. Mayor Bottoms blamed Georgia's rising trend on the, quote, reckless manner the state reopened in, prompting her to pull Atlanta back into phase 1, plus enact the mask mandate.
The data is clear. Our numbers are rising at an alarming rate. It is very clear that our hospitals, in some cases, have already reached ICU bed capacity. Others are quickly approaching it. So we are asking people to do the right thing, be considerate, not just of those in public, but those in your homes.
And the new language in the executive order banning mask mandates was met with fierce criticism from Georgia Democrats, saying more Georgians will die because of Brian Kemp's actions. Live outside the state capitol, Emily Ikeda for Good Day Atlanta.
Still a lot of debate over face coverings. Emily, thank you. On Wednesday, the State Department of Public Health reported more than 3,800 new coronavirus cases and 37 additional deaths. Since the start of the pandemic, more than 127,000 people have tested positive in Georgia. Some Georgia hospitals are seeing beds at full or nearly full capacity. The Grady Health System says its situation is, quote, frightening. But it's not all about COVID-19. State ICU capacity is at 84%, and that number includes COVID and non-COVID patients. Offering an explanation for the increase, the Grady CEO says, quote, during the early days of the pandemic, fewer cars were on the road, crime decreased, and trauma case numbers were down. However, we have seen historic numbers over the last 2 months, and based on what we have seen so far in July, we expect this trend to continue, end quote. By the time this pandemic is over, we all will likely have been exposed to someone with the virus. So what should you do if you find out you've been in close contact with someone who has tested positive for COVID-19? Do you need to get tested? And if so, how quickly? The Fox Medical Team's Beth Galvin joins us live from her home to break down the testing advice. Good morning to you, Beth. There's so many questions here. So we're going to start off with this first one right here. If I've had close contact with someone who is sick, but I feel fine, what should I do?
That's a great question, Sharon, and it's one that I'm getting a lot. So I really wanted to talk about this morning. So, you know, our natural instinct, I think, if we get exposed to this virus is to want to go out and get tested immediately to find out. But that's not really the way to go. And that's why I wanted to talk about this morning. So if you are, if you believe that you may have been exposed to someone who's sick, you want to stay home. You want to self-quarantine for 14 days, meaning treat it like you're sick. And that's really important to avoid spreading this virus to somebody else if, in fact, you are a carrier. So you want to watch yourself for symptoms. If you have no symptoms, now here's what's really interesting. You want to wait, Sharon, 10 days until you get tested. Now that may seem like a really long time, but I talked to Dr. Audrey Arona. She is the health director for interesting. You want to wait, Sharon, 10 days until you get tested. Now that may seem like a really long time, but I talked to Dr. Audrey Arona. She is the health director for the.
What if you're you're exposed and you're starting to feel sick?
So it's going to be along the same lines. You're definitely going to want to isolate and stay home. And again, we're looking at that 14-day isolation period. You do want to talk to your doctor if you're thinking about getting tested, so that, you know, if it's a good idea for you to go get tested, asking your doctor, but also alerting the folks at the testing site, alerting the team that's testing you that you are symptomatic so that they know to take additional precautions. They're already taking a lot of precautions, but you want to let them them know going into it, hey, I've got symptoms and I just need to know. Sharon?
Okay, and speaking of testing site, any idea on how to find a testing site?
So there's a lot of good ideas. And one thing that Dr. Arona was really trying to drive home is your local health department is not the only game in town when it comes to getting tested. So you want to think outside the box a little bit. So they're a great place to start, checking in with your local health department either on its website or going to one of their COVID hotlines to try to sign up and find out what the wait is to get tested. But also start thinking about going maybe to another county. You do not have to get tested in the county where you live. So if you think you're going to have a better chance of, not having to wait in line by going to Rockdale County and you live in DeKalb County, by all means, go ahead and do it. It's your registration and everything is going to be where you live. So you will be counted for the county that you live in, but you can get tested for free anywhere in the state of Georgia. So be willing to drive a little bit. Also, you can look up, is there a COVID testing site in my area online? Do a search. Try urgent care, try CVS, try some doctor's offices are now offering testing. It may take a little shopping around. I think really your best bet is going to be where they give you an appointment, even if it says, you're going to have to wait 3 days and you can come on Thursday at such and such a time or Saturday.